존경하는 참석자 여러분, 2025년 대한통합의학회 국제학술대회가 5분 후 개시될 예정입니다. 참석자 여러분의 원활한 입장을 부탁드립니다. 본 학술대회가 학문적 교류와 지식 공유의 장이 될 수 있도록 여러분의 적극적인 참여와 관심을 기대하겠습니다. 감사합니다. Distinguished participants, the 2025 Korean Society of Integrative Medicine International Academic Conference will commence in 5 minutes. We kindly request that all participants proceed to enter the conference at this time. We look forward to your active engagement and participation, as this academic conference serves as a valuable platform for scholarly exchange and the sharing of knowledge. Thank you. 존경하는 참석자 여러분, 2025년 대한통합의학회 국제학술대회에 참여해주신 모든 분들께 진심으로 감사의 말씀을 드립니다. 저는 본 대회의 진행을 담당하고 있는 대한통합의학회 총무이사 추영기입니다. 이번 국제학술대회는 AI 기반 차세대 디지털 전환 솔루션이 열어가는 미래형 통합의학을 주제로 개최되며 유튜브 플랫폼을 통해 진행될 예정입니다. 보다 체계적인 진행과 참석자 관리를 위하여 유튜브 댓글창에 성함과 소속 기관을 기재해 주실 것을 부탁드립니다. 이는 학술적 신뢰성 강화 및 네트워킹 증진에 중요한 역할을 할 것입니다. 감사합니다. Distinguished guests and participants, I would like to extend my sincere gratitude to all of you for attending the 2025 Korean Society of Integrative Medicine International Academic Conference. I am Yan-Ki Chu, Executive Director of the Korean Society of Integrative Medicine, and I am honored to serve as the moderator for this conference. This year's International Academic Conference is being held under the theme Future-Oriented Integrative Medicine Driven by AI-Based Next-Generation Digital Transformation Solutions, and all proceedings will be conducted via YouTube. To ensure smooth operations and effective participant management, we kindly request that you include your name and affiliated institution in the YouTube comment section. This will significantly contribute to enhancing academic credibility and facilitating meaningful networking opportunities among participants. Thank you. 이제 본 대회에 함께 해주신 주요 인사분들을 소개한 후 본격적인 학술 대회를 진행하도록 하겠습니다. We will now introduce the distinguished guests and key figures who have graciously joined us, after which we will commence the academic conference proceedings. First, the chairperson of this conference, Dr. Tae-young Oh from Silla University, Republic of Korea. Next, we introduce our vice chairpersons, representing various fields and adding depth to our conference. First, the vice chairpersons from the Republic of Korea, Dr. Kyun-cho Lee from Kyungnam College of Information and Technology, Dr. Myung-chol Kim from Ulji University, Dr. Tae-hyung Yoon from Donso University, Dr. Hyun-so Yoon from Dongwei University, Dr. Hae-young Kwon from Dongwei University, Dr. Hyo-jung Lee from Korea National University of Transportation. Next are international vice chairpersons, Dr. Morishita Motoyoshi from Reiwa Health Sciences University, Japan, Dr. Ling Kao-shi from Taizo University, China, Dr. Kumsak Sinsarin from Mahidol University, Thailand, Mr. Jusek Park, President and Chief of Physical Therapy from New York, USA. We continue with our executive directors, Dr. Chul Jang from Kyungnam College of Information and Technology, Dr. Hang-kyu Park from Busan Health and Science University, Dr. Yeon-ki Chu from Gubasang Shim Hospital. Advisory Board members. Finally, we introduce the members of our Advisory Board, all from the Republic of Korea. Dr. Haewon Oh from Woosuk University, Dr. Juhan Jung from Donghae University, Dr. Ki-hun Cho from Korea National University of Transportation, Dr. Wonjun Oh and Dr. Youngju Cha from Cheju Halla University, Dr. Jin-tae Han and Dr. Sang-yo Lee from Kyongsung University, Dr. Jaeong Kim from Kyungnam College of Information and Technology. We sincerely appreciate the dedicated contribution of all these esteemed individuals. Thank you. 이제 본 학술대회의 공식적인 시작을 알리는 순서입니다. 다음으로는 대한통합의학회를 이끌고 계시며 본 학술대회의 주최를 담당하신 이건철 학회장님의 진심 어린 화정사가 있겠습니다. We now move to the official opening of our academic conference. It is my great pleasure to introduce the leader of the Korean Society of Integrative Medicine and the host of this important conference. Please welcome President Kyun-cho Lee to the stage for his welcome address.
안녕하십니까. 대한통합의학회 회장 이건철입니다. 깊어가는 가을 2025년 제11회 대한통합의학회 국제학술대회를 개최하게 된 것을 매우 기쁘고 영광스럽게 생각하며 먼저 진심으로 감사와 환영의 말씀을 전합니다. 특히 바쁘신 일정에도 불구하고 통합의학의 미래를 향한 뜨거운 열정과 깊은 학문적 관심을 가지고 참여해주신 모든 분께 다시 한번 감사의 말씀을 드립니다. Dear members of the Korean Society of Integrative Medicine, KSIM, respected researchers, and esteemed colleagues from around the world, it is my great pleasure to extend a warm welcome to all of you joining us today for the 2025 KSIM International Conference, organized by the Korean Society of Integrative Medicine. This year's conference, held under the theme AI-based next-generation digital transformation solutions for the future of integrative medicine, aims to explore a new paradigm that transcends the boundaries of conventional healthcare. Artificial intelligence, AI, is no longer just a technological tool. It has become a steadfast companion of integrative medicine, enhancing patients' quality of life, improving the precision of clinical decision-making, and revolutionizing the efficiency of medical treatment. Although this conference is being conducted online via YouTube, including keynote sessions, oral presentations, and poster sessions, the depth of our academic enthusiasm and scholarly exchange goes far beyond any physical boundaries. Your active participation brings vitality to this academic event and transforms it into a digital platform of knowledge, vision, and collaboration. AI technology is reshaping healthcare by improving service quality, reducing costs, and creating positive impacts for both patients and medical professionals. First, AI enables telemedicine to overcome geographical limitations, delivering high-quality diagnosis and treatment and expanding accessibility and equity in healthcare services. Second, by analyzing vast amounts of medical data quickly and accurately, AI empowers clinicians to make timely and evidence-based decisions, thereby enhancing both clinical efficiency and diagnostic accuracy. I would like to express my sincere appreciation to all KSIM members who have presented their valuable research papers, as well as to our distinguished participants joining us from the United States, Japan, China, Thailand, and many other countries around the world. It is my sincere hope that the 2025 KSIM International Conference will serve as a meaningful forum for academic advancement and international collaboration. By sharing diverse insights and experiences, I believe this event will offer a precious opportunity to encounter and shape a new concept of integrative medicine for the future. The Korean Society of Integrative Medicine will continue to strive to become a central platform for future-oriented integrative medicine, where science and practice, technology and humanity coexist in harmony. I hope today's gathering will inspire your research and clinical practice, and our executive committee promises to support your continued academic success with our utmost dedication. Finally, I wish all participants good health, happiness, and great success as we embark on this inspiring journey together. Thank you. November 22nd, 2025, Dr. Keon-Cho Lee, MD, PhD, President of the Korean Society of Integrative Medicine.
학술대회의 성공적인 개최를 기원하는 이건철 학회장님의 진심 어린 환영사 감사드립니다. 다음으로는 본 학술대회의 모든 과정을 총괄하며 비전을 제시하고 계시는 의장님을 모시겠습니다. 신라대학교의 오태영 의장님의 환영사가 있겠습니다. Thank you, President Lee, for that truly heartfelt welcome address, wishing us a successful conference. Now, it is time to hear from the individual who oversees all processes and provides the central vision for this event. Please welcome the chairperson of our conference, Dr. Tae-young Oh from Silla University, for his welcoming remarks.
Nice to meet you, everyone. I'm very happy to meet you in here, International Conference of Korean Society of Integrative Medicines. This is 12th year's annual international conference. I'm Tae Yong-ho, who is working for Vice President of Holding Corporation of KSIMs. I'm honored to be a part of this conference with the President Mr. Lee and all of the members of staffs in KSIM. Especially, it is a great thing for me to be a chair of 2025 International Conference. The Korean Society of Integrative Medicine was founded in 2012 years and has been running for 14 years. As the International Academic Conference is now in its 12 years, its academic scope is growing significantly. KSIM, it has been growing into a truly prestigious academic group in Korea, had been selected as a candidate journal for registration by the National Research Foundation of Korea in 2016, as a registrar's journal in 2018, and is now striving to develop into a global academic society targeting the world. In this time, I have to appreciate to all the outstanding scholars from Thailand, Japan, China, and other countries. I would like to express my deepest gratitude to the international scholars who presented their precious research findings as top-class research at our international conference. We can see all of scholars demonstrated their academic passions, their dedicated efforts to the world, and their commitment to enable every individual in the world to design a beautiful life in their own way. KSIM will also assist and collaborate with the research who seek to improve the health and well-being of every individual on Earth. And KSM will serve as a great platform for all the research around the world to come together in future. The topic of this year is connected by data, completed with AIs, KSM vision of new generation digital solution based on AIs. Big data suggests not only an essential tool, but also a new paradigm for research related on medicines. Big data is emerging as a new resource and will completely change the research paradigms. Big data will enable us to create new patterns of research findings that can predict patient recovery or prescribe personalized exercise regimes. The AI is already upon us. We must make the decision to integrate the AI into our clinical knowledge. Today's topic, connected by data and completed with the AIs, presents a significant challenge for us as we forge the first futures. We hope that by continuing our efforts to leverage our capabilities to transform the paradigm shifts of AI and digital solutions, which cannot be overemphasized. Into our own capabilities, we can sustain the academic advancement of researchers in Korea and around the world. With this in mind, I conclude my remarks of gratitude and greetings, believing that advancement of researchers will become the driving force behind the future of Korean Society of Integrative Medicines. Thank you very much. See you again.
오태영 의장님의 미래 비전을 다룬 환영사 다시 한번 감사드립니다. 지금부터 통합의학 분야의 깊이 있는 통찰을 공유할 본격적인 학술 프로그램을 시작하겠습니다. Thank you again, Chairperson O, for those words of welcome and vision. We will now commence the main academic program where we will share profound insights in the field of integrative medicine. The first lecture is Connected by Data, Complete with AI by Tae-Young Oh.
What does artificial intelligence and big data means for the health professionals and researchers in physical therapies? First, big data is a new research source. Electronic medical records, please see the pictures, medical records, wearable sensor data, IMUs, EMGs, motion captures. Population health data by basis, rehabilitation outcome registration. These big data allow research to detect patterns across thousands of patients, predict recovery trajectories, personalize rehabilitation programs, evaluate long-term treatment effectiveness. So, in physical therapies, big data turns clinical experience into quantitative evidence-based insights. I'd like to show you the slide. First, foundation for AI-based personalized treatment. Second, predicting a patient recovery pace. Third, predicting police. Fourth, designing personalized exercise prescriptions. This is big data's contribution to physical therapy professions. And also, big data has completely changed the research paradigms. In the past, researchers have to develop hypotheses, conducted experiments to gathering data, and analyze those data to draw conclusions. In modern eras, the paradigm has shifted to one where we first analyze pattern in vast amounts of data, develop hypotheses, and then verify those hypotheses. This means through the use of numerous health-related smartphone apps, sensor with diverse function, and artificial intelligence that deep learns the vast amount of health-related knowledge, we can obtain an overwhelming amount of data. I believe that our research will inevitably follow this paradigm going forward. However, data can contain a significant amount of sensitive and valuable personal information. Therefore, researchers handling data are required to exercise a strong ethical responsibility. Therefore, research must establish mechanisms to protect personal information. The potential harms of algorithm must be considered. We must prevent error in data interpretation and refrain from excessive data productions. I believe it is crucial to develop ethical sensitivity, which is the fundamental tenet of research, and sufficient capabilities in statistics and programming. Next slide, I'd like to explain the trend of connected by data completed with AI. Intelligent AIs rehabilitation system is growing centrally of AI in rehabilitation system. In particular, advancing machine learning-based diagnostic technology and customized training algorithms are enabling precision medicines, analyzing patient rehabilitation status in real time, and suggest the optimized treatment path. Combined with the advancement in interface technology, user-friendly rehabilitation environments are becoming increasingly common. Second, neurostim therapies. With the rise of keywords like brains, nerves, and stimulations technologies, those aimed at restoring function after brain and nervous system damage are actively being developed. In particular, high precision rehabilitation treatment systems are evolving through the convergence of electrical stimulations based rehabilitation technology and brain-computer interface technology to improve physical and cognitive impairment caused by stroke. With the emergence of keywords like emotional, minds, and motivation, rehabilitation technology is expanding beyond the physical recovery to including consideration of patient emotional state and psychological motivations. These systems design that integrate psychological supports and motivation are contributing to maximizing rehabilitation activities, suggesting important directions for the future development of rehabilitation techniques. When we discussing the field of physical therapy utilizing AI and big data, the most compelling approach is motion analysis system using inertial sensors as it eliminates the need of expensive and bulky camera. As you see, IMU inertial measurement unit is a sensor device that can measure motion and orientation using a combination of accelerometers, gyroscopes, and sometimes magnetometers. It detects how an object moves, tilts, rotates, or accelerates in space, but without relying on external reference like cameras. IM sensors are widely used for gaits and posture analysis, joint angle movement trackings, home-based rehabilitation monitorings for detection or balance assessments. Because IMU are small, portable, and inexpensive, they allow real-time motion analysis outside of lab, for exam, in clinics or patient home. I'd like to introduce one article in Korea. This article was written by medical doctors in Korea. The survey on the use of smartphone application in stroke rehabilitation in Korea report the result of survey on the perception of professional involved in stroke rehabilitation. Most respondents, pediatrics, medical doctors, nurse, occupational therapist, physical therapist, all of respondents agree that smartphone application could be used for cognitive trainings, language training, ADL trainings, providing informations, motor trainings. Across occupational groups, doctors, nurses, and physical therapists all showed high level of agreement regarding the use of smartphone app to provide health-related information. Overall, doctors showed the lowest level of agreement regarding smartphone app use compared to other occupations. Occupational therapists also expressed positive agreement regarding the potential use of smartphone apps for various purposes in stroke patients' rehabilitations. You can see by seeing this graph. In conclusions, this is the era of connected by data completed with AIs. Big data goes beyond the stage of information collection. Big data will become a new language for research, answering clinical and scientific questions. Furthermore, researchers must cultivate integrative thinking and continuously hone their data understanding skills. I believe this attitude researchers should adopt in the data-driven era. KSIM is not satisfied with being a Korean registered journals. It invites outstanding research from around the world and strive to grow into a world-class journal together. I'm privileged to establish itself as an academic portal site for the era of artificial intelligence and big data. This concludes my presentation. Thank you very much.
The next lecture is Application and Outlook of AI in Healthcare, from data-driven AI to
예, 여러분 안녕하십니까? 오늘 AI 기반 차세대 디지털 솔루션이 여는 미래형 통합의학이라는 주제로 기조 강연을 맡은 유명산입니다. 현재 이 순간에도 아마 전 세계 의료 데이터는 1초에 수백만 단위로 쌓이고 있을 것입니다. 그리고 그 데이터를 해석하는 AI는 점점 더 인간의 지식과 판단을 닮아가고 있습니다. 그래서 오늘 저는 데이터 기반 AI에서 자율학습형 AI로라는 큰 흐름 속에서 의료의 미래가 어떻게 새롭게 설계될 것인가를 여러분과 함께 살펴보고자 합니다. 지금 현재 우리가 마주한 변화는 단순한 기술 발전이 아니라 환자가 아프기 전에 의료가 먼저 움직이는 시대, 그리고 문제를 기다리지 않고 예측하는 의료, 마지막으로 스스로 학습하는 AI가 함께 일하는 의료로 나아가는 여정에 서 있습니다. 이 흥미로운 여정에서 첫 페이지를 여러분과 함께 열어갈 수 있어서 커다란 영광입니다. 발표 순서는 크게 세 부분으로 구성되어 있습니다. 첫 번째로 헬스케어 산업과 AI 융합 현황에 대한 부분, 두 번째로 데이터 기반의 AI의 성과는 어떻게 나타났는지, 그리고 마지막으로 AI 헬스케어 산업의 미래와 데이터 기반의 AI의 진화는 어떠한 방향으로 나갈지에 대해서 말씀드리도록 하겠습니다. 현재 AI는 의료 부분에 있어서 많은 부분을 차지하고 있습니다. 그래서 AI의 의료는 진단, 치료, 결과 등을 포함한 환자의 경험을 지원하고 개선을 목적으로 다양한 형태, 기계학습, 자연어 처리, 딥러닝 및 기타 AI 툴을 사용한 것으로 얘기할 수 있습니다. 그래서 헬스케어 산업 범위 안에서 AI 의료는 현재 많은 부분을 차지하고 있습니다. 이렇게 AI의 헬스케어 산업이 부상하다는 배경을 살펴보면은 결국엔 의료 환경과 기술의 진화가, 그리고 시장의 성장, 그리고 산업 간의 융합과 새로운 기회의 창출이라고 얘기할 수 있습니다. 특히 정밀 의료, 건강관리, 디바이스 등의 기술 서비스가 융합되면서 다양한 형태의 헬스케어 산업이 부상하고 있습니다. 자, 그래서 AI와 헬스케어의 정의를 한번 살펴보면은 방대한 양의 다양한 의료 데이터를 스스로 학습하고 분석하여 헬스케어 서비스에 적용함으로써 질병 예측 및 맞춤형 치료 등 혁신적이고 고부가가치를 제공하는 새로운 의료 서비스를 의미한다고 말할 수 있습니다. 즉, AI는 이 둘을 통합 분석해 의료 의사결정의 정밀도를 높인다고 말할 수 있습니다. 그래서 현재 AI의 기술은 의료에 상당한 부분을 적용하고 있습니다. 특히 기존 데이터와 신규 데이터를 융합하여 새로운 가치 창출에 나아가고 있습니다. 그러나 이 AI 헬스케어는 그 개념적 정의가 근접하기 위해서는 빠른 속도로 발전하고 있으나 현존하는 AI 기술은 아직 독립적으로 학습하고 해석할 수 있는 단계까지는 이루지 못하고 있습니다. 그럼에도 불구하고 AI는 현재 많은 부분에서 적용되고 있습니다. 특히 자연어를 처리를 통해서 인간의 언어 형상을 이해하고 분석하여 컴퓨터가 처리하는 형태로 바꾸는 기술들은 이미 많이 경험해 봤을 거라고 생각합니다. 그리고 영상인식, 음성인식, 거대한 LMM 모델을 통해서 많은 AI 기술들이 의료 분야에 적용을 하고 있습니다. 특히 영상 AI는 사람과 유사한 수준의 정확도를 보이면서 실제 임상 서비스로 발전하고 있습니다. 그러나 현재 이러한 데이터 기반의 AI를 넘어서 새로운 시대의 AI로 전환의 필요성을 이야기하고 있습니다. 즉, AI가 스스로 학습하고 판단하는 수준까지 이르기 위해서 많은 연구들이 진행을 하고 있습니다. 어쨌든 현재 시점에서 데이터 기반의 AI 성과는 되게 임프레시브하다고 합니다. 그러나 현재 AI는 특정 환경이나 특정 데이터에만 최적화되는 경향이 있습니다. 그래서 많은 연구자들은 향후 AI는 자율학습형으로 진화할 필요가 있다고 이야기를 하고 있습니다. 즉, 자율적 학습 AI란 AI가 스스로 데이터도 탐색하고 주어진 문제를 스스로 정의할 수 있으며 환경 변화에 맞게 모델을 재구성하는 AI라고 말할 수 있습니다. 특히 장애 2023 연구에서는 이러한 것들을 복잡성 환경에서 스스로 학습하는 AI가 인공지능 발전의 핵심이라고 강조를 하였습니다. 글로벌 기업들도 자율 학습형 AI 개발을 먼저 전환을 하고 있습니다. 딥마인드나 메타에서는 이러한 AI를 의료 분야에 자율화 학습형으로 적용하는 연구를 진행하고 있습니다. 더군다나 딥마인드에서는 자가 학습 기반 모델을 만들어내고 있으며 메타에서는 대규모 의료 기반의 AI 연구 그리고 대규모 멀티모달 개발들을 진행하고 있습니다. 이처럼 세계적인 기업들도 스스로 학습하는 AI로 전환을 꾀하고 있습니다. 그렇다면 현재 데이터 기반의 AI들은 어떠한 성과를 나타내고 있는지를 살펴보도록 하겠습니다. 지금 제시한 사례들은 국가수리과학연구소에서 데이터 기반 AI의 성과 사례라고 말씀드리도록 하겠습니다. 사실 해당 부분의 성과 사례들은 다양한 부분이 있겠지만은 제가 근무하는 국가수리과학연구소에서 국내 유수의 병원들과 협력한 사례를 토대로 말씀드리도록 하겠습니다. 첫 번째 사례는 발병입니다. 발병에서는 사실은 삼성의료원 순환기 내과와 같이 공동 연구를 진행했으며 코로나19의 확산 예측 모델을 개발해서 정부 방역 정책의 의사결정에 직접적으로 기여를 하였습니다. 해당 모형은 마이크로 시뮬레이션과 병력 컴퓨팅을 활용해서 확진자의 증가 속도, 방역 정책 효과를 정량적으로 예측한 사례라고 보시면 되겠습니다. 자, 두 번째 사례는 진찰에 관련된 부분입니다. 해당 부분도 삼성의료원 순환기 내과와 같이 공동 연구를 진행했으며 시계열 혈압 데이터로부터 환자의 상태를 유추할 수 있는 지표를 도출하기 위해 혈압 데이터에서 분석이 가능한 영역을 자동으로 추출하고 추가별로 데이터를 분석하는 소프트웨어입니다. 이런 소프트웨어는 환자별 건강 수치 변동을 실시간 분석해서 맞춤형 건강관리 서비스로 발전한 사례라고 볼 수 있습니다. 세 번째 사례는 검사 영역입니다. 이것은 세브란스 영상의학과와 같이 진행된 공동 연구로 CT 촬영 시 인체 내 금속 물질에 의해서 발생하는 인공물을 제거된 영상을 복원하는 부분입니다. 이런 부분들은 수학적 모델링이나 딥러닝, 최적화 이론이 적용되었고 해당 부분을 통해서 수술용 금속 임플란트로 인해 흐릿해지는 영상 문제를 AI로 해결할 수 있는 기술입니다. 따라서 이러한 기술을 통해서 수술 계획 정확도를 향상 보이는 성과를 보였습니다. 다음은 진단에 기반한 내용입니다. 해당 부분은 서울대학교 어린이병원의 영상의학과와 같이 진행된 사항입니다. DDH는 대퇴골 두 주위가 비정상적으로 발달하여 생기는 장애로서 소아에게 주로 발생하는 발병입니다. 따라서 이런 부분들을 조기에 진단 모델을 만들어내기 위해서 엑스레이 영상에서 DDH를 자동 스크린하는 알고리즘을 개발하였습니다. 이러한 알고리즘을 통해서 정확한 계산과 특징을 추출을 자동화해서 소아의 진단의 정확도를 높인 기술입니다. 그래서 해당 부분은 인체 내의 병변이 정확한 임상 진단에 기여하고 판독에 소요되는 시간 및 비용을 절감함으로써 의료의 질적인 향상을 기대할 수 있다고 보고 있습니다. 또한 이제 데이터 기반의 치료 계획에 대한 부분입니다. 데이터를 활용하는 부분으로서 충남대학교 비뇨기과와 같이 공동 연구를 한 부분입니다. 충남대학교에서 보유하고 있는 데이터를 활용해서 요로결석 쇠석술 치료의 성공 여부를 예측하는 부분입니다. 이런 부분들은 데이터 처리 분석, 데이터 모델링, 그리고 기계학습 알고리즘과 최적화 기법을 활용하였으며 기계학습을 이용해서 쇠석술 치료 시술 데이터와 혈액 분석, 그리고 소변 검사, 융합 데이터와 적합한 기계학습 알고리즘을 적용하여 80% 이상의 정확도를 갖는 예측 모델을 개발하였습니다. 이러한 개발을 통해서 치료 비용 및 시간, 그리고 실제 진료에 이용할 수 있는 진단 지원 시스템이 될 것으로 기대하고 있다고 충남대학교 병원에서는 이야기를 하고 있습니다. 이렇게 기본적으로 AI는 의료에서 많은 부분에서 활용을 하고 있습니다. 특히 지금 사례에서 살펴보았듯이 의료 영상 부분에서는 많은 부분에서 실제 임상 서비스로 발전하고 있는 것이라고 볼 수 있습니다. 그러나 이러한 그 데이터 기반의 AI는 한계를 가지고 있다고 볼 수 있습니다. 그래서 앞으로 AI 헬스케어 산업의 미래와 데이터 기반 AI의 진화는 어떤 방향으로 진행되어야 될 것인가에 대해서 여러분들과 같이 이야기하도록 하겠습니다. 현재 글로벌 헬스케어, AI 헬스케어 시장은 2030년까지 현재보다 약 10배 이상의 성장을 전망하고 있습니다. 특히 영상 AI, 예측 AI, 그리고 바이오 의료 융합 AI 중심으로 확대될 것으로 예측을 하고 있고 국가별로도 AI의 의료 규제 프레임워크는 좀 더 정교화될 것이라고 보고 있습니다. 따라서 전 세계적으로 이러한 의료 AI는 급속하게 산업화를 진행하고 있습니다. 그러나 이러한 데이터 기반의 AI는 커다란 한계를 가지고 있습니다. 현재 데이터 의료 기반의 AI는 가장 민감한 부분이 바로 데이터에 있다고 볼 수 있습니다. 의료 분야에서 가장 민감한 부분이 바로 편향된 데이터입니다. 이러한 부분에서 편향된 데이터의 문제는 환자의 치료 결과에 직접적인 영향을 미칠 수 있는 핵심 리스크입니다. 또한 특정 환경에서만 최적화된 모델 구조로 만들어져 있고 임상 적용을 위해서는 일반화 능력이 부족한 것이 현재 데이터 기반 AI의 한계점이라고 할 수 있습니다. 바로 이것이 우리가 해결해야 할 중요한 과제입니다. 이제는 헬스케어 산업의 미래와 차세대 A라는 시대가 도래하였습니다. 즉 데이터 기반의 AI가 아니라 새로운 헬스케어 산업의 AI가 도래되면서 이 문제를 해결할 수 있는 방향을 찾아갈 수밖에 없습니다. 이러한 방향은 결국 차세대 AI의 발전 방향은 즉 자율형 학습형 AI라고 할 수 있습니다. 자율형 학습 AI는 인간의 의료 문제를 스스로 재구성하고 인간에서 발생하는 노이즈나 비정형 데이터 환경에서도 정확도를 유지할 수 있어야 하며 의료진이 개개인의 임상 상황에 맞춰 스스로 학습하는 모델이라고 할 수 있습니다. 따라서 미래의 의료 AI의 핵심은 단순한 고도화나 데이터 향상이 아닙니다. 이것을 벗어나 AI는 스스로 진화할 수 있는 AI로 전환이라고 말씀드릴 수 있습니다. 바로 이러한 AI 전환이 앞으로 우리가 나가야 할 혁신의 다음 단계라고 말할 수 있습니다. 자, 오늘 말씀드린 것처럼 AI는 더 빠르게 그리고 더 효율적으로 만드는 것을 이제 넘어서 환자의 미래를 먼저 보고 움직이는 의료 시스템으로 변화하고 있습니다. 그리고 우리는 현재 시대에서 스스로 학습하고 진화하는 의료 AI 시대를 준비하고 있습니다. 이제 앞으로 AI는 의학을 대체하는 기술이 아닙니다. AI는 의료진과 함께 환자의 삶을 지켜주는 새로운 파트너가 될 것입니다. 아마도 AI가 도래됨으로써 의료진은 환자와 함께 같이 동행하는 중요한 요소로 자리 잡을 것이라고 생각합니다. 여기 참석한 여러분들도 각자의 자리에서 이러한 의료의 미래를 함께 만들어 나갈 수 있기를 진심으로 기대합니다. 오늘 강연을 함께 해주셔서 정말로 감사드립니다. 감사합니다. 함께 만들어 나갈 수 있기를 진심으로 기대합니다. 오늘 강연을 함께 해주셔서
The next lecture is Non-Contact ACL Injury Risk and Risk Assessment by Comac Sinsarin.
Hello, everyone. First of all, I would like to say thank you for Korean Society of Integrated Medicine Journal for inviting me to join as the speaker for providing the special talking related with my experience in clinical practice and my research today. So I am Dr. Komsak Sinsarin. So I am a sport physical therapist. So this is my talking today. It's related to non-contact ACL injury risk and risk assessment. Okay. So this is where I'm from. So I work as the lecturer and also the researcher at Faculty of Physical Therapy, Mahidol University in Thailand. So as you guys have known that mostly the non-contact ACL injury is occur during one leg landing and also like one leg cutting during change of directions from running. So you can see this guy, for example, they jump and landing, but you can see that trunk also rotation during they perform or they're floating in the air, and after that they're landing with the single leg landing. And also you can see this guy after smashing, you can this guy would like landing with single leg landing, and you can see his trunk also rotational movement during the flight phase as well. So that's why most kind of the biomechanics research they try to examine the influence of biomechanics risk that would be the biomechanic contributors to the risk of non-contact ACL injury. So mostly the non-contact ACL injury occur during single leg landing. So this is the examples of the non-contact ACL injury occurring during single leg landing. So you can see this girl after she was landing with a single leg, and she suffered from the non-contact ACL injury on the left knee. So this is the typical patterns of movement occurring during non-contact ACL injury. But when we try to analyze in detail, mostly the research suggests that the dynamic knee focus is the main parameters or the major parameters that contributing to non-contact ACL injury. But anyway, ipsilateral trunk leaning or the excessive hip abductions or hip internal rotation, these are the confounding factor. These are the contributing factor to the non-contact ACL injury as well. Okay. It's the typical pattern of the dynamic knee focus during cutting movement. Okay. So we are the health profession. We think that the prevention is the most important intervention that we should provide for all athletes to prevent the injury. So the prevention is much better than effective intervention. Absolutely. So that's why how can we design the prevention program? So right now the injury risk assessment is very important to investigate the risk of non-contact ACL injury. If the health profession can assess the risk of injury, so we can provide the intervention or physical therapy program or rehabilitation program for our athletes to prevent the non-contact ACL injury. So these are the common the clinical assessments for the athletes during landing and also during the cutting movement. So let I introduce the first one, which is we call the LASS, or it stands for Landing Error Scoring System, which is a field assessment tool for identifying potential high-risk movement patterns, or we try to identify the movement error during double leg jump landing. So LASS is based on the continuous 17-point scale and show having a concurrent validity with the 3D motion analysis and good inter and intra-rater reliability. And the more score of the result mean high movement errors and having a chance of sustaining ACL injuries. And the cut-off score to identify the non-contact ACL injury, if the assessment score it's more than and equal 5, so we can identify that athlete who has the high risk for sustained ACL injury. Okay, and this is the testings of the landing error scoring system. So we ask the athlete stand on the platform, 30 centimeter high platform, and set the distance from the platform to the landing point is approximately 50% subject height or athlete height. And then we ask them to jump and landing with the double leg and try to jump immediately with the highest height as the athlete can. So after that, during we test the jump and landing task, we record the video in the front view and also the side or the side view as well. Then we use the video recording and then we scoring the movement error in all items here. So if we found some movement error, so we're gonna give the score as 1. But if absent movement error, so we're gonna give score 0. So for instance, in the movement assessment, the first criteria, which is the tester or the sport PT gonna observe the knee flexion at initial contact. So in the video to observe the knee flexion, so we're gonna take a look on the video in the side-by-side view to observe the knee flex. If the knee flex is flexed less than 30 degrees at the initial contact, so we're gonna give score 1. But if the athlete contact the ground with more than 30 degrees of knee flexion approximately, so we're gonna give score 0. So this is the for example. And the second item, so we're going to observe the hip flexion at initial contact phase here. So we observe the thigh is in line with the trunk at initial contact. So that means we observe how the jumper contact the ground with how the jumper set up the trunk relative to the pelvic or the thigh. So if the jumper landed or the contact the ground with more trunk flexion, so we're going to give 0. But if the thigh segment which is in line with the trunk, so that means the movement during initial contact is quite similar as the straight line, so which is the risk of high impact during landing, so we're going to give score as the 1. So the health profession can observe all items here and give the score in each item and then summation or score at the end. So if the score greater than 5, 5 more than and equal than 5, so that athlete has the higher risk of non-contact ACL injury. So as we are the physical therapist, so we can like use this assess the risk of non-contact ACL injury. At the first round, when we assess the first round, and we found like total score of lead is quite high, and we found the presence of movement error in which item. So we can provide the instruction or educate them how to land with the correct movement, and then let them have the training and rehabilitations, and then we can reassess with the less or the landing movement error score system again to observe each criteria or each item again, and also compare each item and also compare the total score between round 1 and round 2. So then we can like we can see the progression after we provide the preventive program. So this is the how can we use the assessment tool. And the second assessment tool, so we call the modified landing error scoring system, or we call LESM. Actually, this is our work in my lab. So we conduct this kind of research to develop like a modified version of LES in order to fill some gaps or some limitations of the LES. So as I mentioned earlier, the LES, we asked the athlete to perform jump and landing with the double leg and also in the forward direction. But actually, as I like introduced you in very like first or second slide, so mostly the athlete perform jump and landing, and sometimes they rotate their trunk or their movement during jump and landing, and also they perform jump and landing in various directions. It's not jump and landing perfectly in vertical or just only the forward direction. So we thought that the landing error scoring or assessment, so we should assess in the risky direction as well. That's why we modify the LES, and we call LESM. So the original LES limitation was jump landing test with double legs in forward direction, as I mentioned, and we developed the LESM is designed to assess lateral single leg jump landing. So we decided to design the jump landing task. We change from double leg to the single leg, and also we ask the athlete to perform jump landing in lateral direction. As our like previous study, we confirm and we found that lateral directions of landing show the higher risk of non-contact ACL injury than the forward direction. That's why we designed the jump landing in lateral directions. This is the all items criteria of the LESM that we developed from the literature review and also our previous studies. So finally, we have like 12 items. So, and we try to design the LESM to easier and like easier for using and like not like too complexity for all clinicians. So we separate in the testing plane into 2 planes, so including forward planes and sagittal planes here. And we ask the tester to observe the trunk, pelvis, and hip joint, knee joint, and ankle joint. So the first item, the tester or the clinician have to observe the ipsilateral leaning of the trunk towards the landed leg during the landing phase. So like very like high trunk leaning to the stand limb, so which is quite high loading on the landed side, so we identify as the risk of injury. So, and the second item, we need to observe the contralateral pelvic drop during landing. The third item, presenting hip abduction or internal rotation at initial contact, showing displacement of knee valgus motion after initial contact. We also observe the participant lands with a toe out positions of the ankle. So these are all items that we're observing in the frontal plane. So how about the sagittal plane, or we need the video capture that we place the camera in the side by side or in the side view. So we observe the upright or extended trunk during the landing phase. We observe, or is there any like obvious or detectable trunk rotations movement during the landing phase, or like how the hip is flexed, like less than 40 degrees at initial contact, or knee is flexed less than 20 degrees at initial contact, or the jumper like land with the hyperextension of the knee during landing phase, or participant land without forefoot contact. And the last item we observe, ankle is plantar flexion to like less than 20 degrees at initial contact. So, and then we sum score for the left side and for the right side as well. Okay. Firstly, we can compare like the score, total score between limb, and also we can like compare total score or compare by item between as like repetitive assessment in round 1, round 2, or round 3 to observe the progression of our case as well. So after we develop the LESM, we conduct the research to test the content validity assessment. So we invited 5 experts in the field to assess the content validity. So this is the statistical analysis to observe the content validity with the CVI or content validity index. And we found that the average content validity index, it is like 0.97. So it's pretty high. So it's mean that LESM has high content validity from 5 experts in like various countries. And next, we also comparing the LESM measurement to the standard motion capture or the 3D motion analysis. So we asked the jumper or the athlete to perform single leg jump landing in lateral directions. Doing we capture the 2D camera as the LESM protocol, and also we capture the 3D motion with the Vicon motion analysis. At the same time, as we show on the figure here, right? So we capture the movement at the same time, and this is the example of the video example during we capture single leg landing in the lateral directions. Yeah, and this is the figure during this is the when we ask the jumper stand on the platform and then landing at the center first step here. After finished, we construct the 3D motion model to extract the knee valgus angle, and we compare or we investigate the correlations of the total LESM score and also the key parameters, key biomechanical parameters that we extract from the 3D motion analysis, which is knee valgus in this study. So we found the moderate correlations between LESM score and knee valgus with significant. So the coefficients 0.4 to 5, and also we found the moderate correlation of the LESM score and hip abduction moment equal 0.446 with significant. So as we conducted the research, we summarized that the LESM show high content validity and moderate concurrent validity. So the LESM could serve as a potential tool for identifying non-contact ACL injury risks. So is there anyone interested to read through this study in detail? So you can go to the Physical Therapy in Sport journal, and this is the reference, or you can scan this QR code. So then you can download the full version of the LESM as well. All right, and we expect to expand for all health professions, including in sport science field or in the sport medicines or the sport physical therapy field, to use the LESM, which is assess the risk of non-contact ACL injury with to assess in the single leg landing in lateral direction, which is more challenging than the original LES. Okay. All right. Okay. All right. Let's move to the measurement tool in the next measurement tool, which is the cutting movement assessment score, or we call CMAS. Okay. So the CMAS is qualitative screening tool that assess cutting movement quality and specific lower limb and trunk characteristics that are associated with non-contact ACL injury. Okay, and the CMAS may have the potential to identify athletes displaying high-risk cutting mechanics, but more importantly, could be used as a technical framework for coaching safer cutting mechanics. Again, so we can use our measurement tool as the assessment tool. After we use this assessment tool to identify the movement risk or the movement error or the risk of non-contact ACL injury, we can provide the intervention or rehabilitation or the preventive program, and then after finish the program of the preventive interventions, so we can reassess again. So this is quite this is the benefit that we get from the assessment to compare round 1, round 2, and observe any item that changed from like present to absent, absent to present, and compare between round 1 and round 2, something like that. So it's pretty helpful. But anyway, the cutoff score for CMAT, they suggest the score of 7 to identify the like high risk of non-contact ACL injury. So this is the cutting task that we also like place the camera in front view, and also the inside view as well to observe the movement error in like side by side, and also observe the movement error in sagittal movement. Okay. Again, this is asked to cutting with the maximum speed as he can. Okay. And then we use the recording video, and then we scoring all item here of the CMAS. Like if we can observe the movement in each item, so we're gonna provide a score 1 or 2 or 0 by item, and then like sum the score as the total score. Okay. Yeah, that's the CMAS. So this is the all like example of the measurement tool or the clinical tool that we can apply in the field to assess the athlete in jump landing tasks and also in the cutting tasks. So you can pick up like less M or CMAS to assess the athlete performance. But anyway, you need to consider you're going to pick up less M or the CMAS depends on like sport type or the sport athlete. For instance, if you assess the risk of non-contact ACL injury in volleyball player, so I would say, okay, the less M would like more appropriate to assess the risk of injury larger than the CMAS. But because we want in volleyball player, mostly they perform jump and landing, not cutting, right? But if you assess the risk of injury for the soccer player, so I would say, okay, CMAT would be like more appropriate. But if you would like to assess in basketball player, so I would say, okay, you can like pick up both, like less M and also the CMAT as well as the basketball player. Usually, typically they perform jumping, landing, and also running as well, cutting as well. So that's why we need to assess both types as well. Okay. So, okay, to the last, my home message for my talking today. So jump landing direction significantly affects on lower extremity biomechanics. So as we are the health profession, we need to assess in all directions as possible. Like if we can assess in all directions, that would be perfect. But if we cannot like, assess in all directions, so I would say, okay, we need to prefer like what in the direction that's very challenged for the athlete to observe the risk of injury. Okay, and the measurement tool should be used in order to risk screening for injury prevention. And the less M could serve as the potential tool for identifying non-contact ACL injury risk. And last one, okay, for the research in the future, may focus on the effective of rehabilitation or neuromechanics parameter in athletes with ACL, which is in our lab now we have developed the innovative rehabilitation for athlete after reconstruction and also in athlete with chronic ankle instability as well. So hopefully we can publish the result in the next year. So stay tuned to see our result, and then you can apply the rehab program or the physical therapy for your patient or your athlete. Okay. Okay, that's all my talking today. Hopefully it would be like provide some benefit for you guys. Okay. And lastly, I would like to like thank you for my consultant and also my postgraduate student, also the alumni in the biomechanics and sport laboratory of Faculty of Physical Therapy in Mahidol University to contribute to all this, contributing to the knowledge and research information that I presented for you guys today. Okay, that's all my content today. So thank you very much.
Finally, lecture is toward a new paradigm of research ethics by Hank-Yu Park.
안녕하십니까. 2025년 대한통합의학회 국제학술대회에 참가하신 여러분들 진심으로 환영합니다. 저는 오늘 연구윤리의 새로운 패러다임을 향하여 라는 주제로 발표를 맡은 학술이사 박한규라고 합니다. 오늘 저희는 2025년 11월 22일을 기점으로 연구윤리 분야에서 주목해야 할 핵심 가치와 최신 동향에 대해서 논의를 하고 대한통합의학회지가 연구윤리 방향에 있어서 나아가고자 하는 방향성을 한번 제안하고자 합니다. 자, 시작하도록 하겠습니다. 첫 번째, 요즘 모든 연구자들이 생성형 AI를 굉장히 많이 사용하시는 걸로 알고 있습니다. 이러한 패러다임이 연구에서도 방향성들을 바꾸고 있고요. 특히 AI 도구의 사용이 표절이나 부정행위, 데이터 조작 등의 윤리적 문제를 초래할 수 있기 때문에 이러한 부분들을 저희가 한번 고민을 할 필요가 있다고 생각이 됩니다. 자, 두 번째, 한국과학기술젠더혁신센터에서는요, 젠더 혁신을 굉장히 중요시하고 있고요. 이러한 부분들은 성별 등 다양한 특성을 반영한 연구를 통해 공정한 과학기술 연구 개발에 새로운 지평을 열기 위해서 최근에 굉장히 많은 관심과 발전들이 이루어지고 있습니다. 이러한 부분들을 통해서 저희 대한통합의학회가 나아가고자 하는 방향성을 한번 제시해 보려 합니다. 일단 연구윤리라는 아주 고전적인 의미입니다. 연구윤리란 연구 수행 과정에서 지켜야 할 도덕적, 사회적 기준을 의미하며 진실성이나 정직성, 투명성을 기반으로 해야 합니다. 이러한 핵심 가치에는 네 가지가 있습니다. 정직해야 되고 연구의 객관성이 유지가 돼야 되며 재현성과 신뢰성이 뚜렷이 보여야 되며 연구를 진행함에 있어서 공정성들이 굉장히 중요한 부분이다 라는 것들은 우리 연구자다라고 하시면 모두 다 아시는 부분이라 생각이 됩니다. 또한 이러한 연구 윤리의 필요성에 대해서는 강조를 해도 지나치지가 않죠. 연구 결과의 진실성을 보장하여 과학 전반에 대한 신뢰를 구축을 하며 정직한 연구 수행은 연구자 개인의 전문성을 지키는 근간이 될 수 있습니다. 또한 윤리적 기준이 확립되어야만 학문 공동체가 건전하게 성장할 수 있는 밑거름이 된다고 생각이 됩니다. 또한 기관이나 연구 지원 주체로부터 지속적인 신뢰관계를 얻기 위해서는 이 연구의 윤리는 굉장히 중요한 부분이 아닌가 생각이 됩니다. 이러한 연구 부정행위가 몇 가지가 있는데 존재하지 않는 데이터를 조작한다거나 결과를 의도적으로 수정한다거나 타인의 아이디어나 문장을 출처 없이 사용을 하게 되면 연구 부정행위로 간주가 되고 있고요. 또한 부적절한 저자 표시라든지 중복 게재는 연구 윤리에 위반되는 행위입니다. 자, 이러한 부분들은 저희 대한통합의학회 연구 윤리 규정에도 명시를 하고 있습니다. 위 QR코드를 보시게 되면은 충분한 내용들을 확인하실 수가 있고요. 만약 연구 윤리에 위배되는 사항들이 있다라고 되면 일단 게재가 불허가 되고요. 삭제 조치가 이루어지며 최소 1년간 투고는 금지되어 있습니다. 그리고 이러한 사실들을 공표를 하며 소속기관이나 연구재단에 통보를 하게 되어 있습니다. 따라서 조사나 반론 절차 등이 명시되어 있기 때문에 우리 연구자들은 투고 전에 반드시 확인해야 할 부분이 아닌가 생각이 됩니다. 자, 여기까지가 일반적인 연구 윤리에 대한 고전적인 의미로서 말씀을 드렸다고 하면요. 지금 이 슬라이드부터는 최신 동향으로 대한통합의학회가 앞으로 연구 윤리에 있어서 나아가야 할 방향성들을 먼저 얘기하고 있습니다. 일단 연구 윤리의 최신 동향 첫 번째, AI나 저자에 대한 기준 강화입니다. 2020년 11월 22일 개정 이후에 AI와 관련된 내용이 보강된 최신 연구 윤리 동향에 대해서 말씀드리도록 하겠습니다. 현재 국제적인 기준으로 봤었을 때는 AI는 저자가 될 수 없다는 것을 얘기를 하고 있습니다. ICM 제2 국제의학저널 편집위원회에서는 AI에 대한 저자 및 심사 지침이 강화가 되고 있고요. COPE 즉 출판윤리위원회와 세계의학 잡지 편집자 협회 역시 AI를 저자로 인정하지 않으며 AI 사용 시에는 투명하게 고지할 것을 말씀을 하고 있습니다. 또한 국가 R&D 길잡이에서도 AI 활용, 연구노트, 이해상충 등에 대한 실무화가 진행이 되고 있습니다. 자, 그러면서 ICMJ가 제시하는 4가지 요건을 충족을 해야 됩니다. 저자가 되려면요. 논문에 기여를 해야 되고 페이퍼 작성, 수정, 그리고 최종 승인, 책임 공유가 필요합니다. 이런 의미에서 AI는 기여도 할 수 있고 작성, 수정, 최종 승인까지 또는 아이디어까지도 제공할 수 있지만 책임 공유 부분에 있어서는 큰 오류를 범하기 때문에 AI가 저자로 속하지 못한다라는 얘기들을 하고 있습니다. 자, 두 번째, 연구윤리의 최신 동향입니다. 의생맥과학 연구에서 성별과 젠더의 중요성들을 명시하고 있습니다. 이 역시 젠더 혁신 정책과 관련하여 내용이 보강된 부분입니다. 먼저 성별, 젠더의 정의부터 말씀을 드리자고 하면 성은 염색체나 생식기관, 호르몬 등의 다양성들을 존중하고 있는 생물학적 특성을 얘기하는 게 성이고요. 젠더 같은 경우에는 사회적, 문화적, 심리적 특성으로 구성된 개념을 의미하고 있습니다. 특히 의생명학과학 연구의 목적은 인류의 건강 증진과 질병 치료이기 때문에 성별이나 젠더는 건강 질병에 영향을 미치는 핵심 변수로서 각광을 받고 있고 꼭 명시해야 하는 연구 윤리의 한 분야가 아닌가 생각이 됩니다. 이러한 부분들이 대두된 데 있어서는 다음 슬라이드 보시게 되면은 과거 미국에서 2000년 초반에 10개의 약물 중에서 8개가 폐기 처분되었습니다. 이거는 남자, 여자의 성별을 고려하지 못한 부작용들이 나타났기 때문입니다. 또한 이러한 부분들은 기초연구, 심지어 세포라든지 그리고 신진대사와 관련되어 있는 대사차 중에서도 이러한 성별에 따른 농도 차이가 명확히 극명하게 드러나기 때문에 이러한 편향된 젠더의 연구는 오류가 많다라는 것을 얘기를 하고 있고 이 부분 역시 저희 대한통합의학회 연구윤리에서 앞으로 명시해야 할 부분이 아닌가 생각이 됩니다. 그리고 국제적 정책 변화와 연구 방향 그리고 또는 연구 단계별 지침에 있어서 특히 이제 성별을 필수적으로 고려해야 한다. 국제적 정책 변화가 있기 때문에 생물학적 변수들을 포함하도록 권장되고 있습니다. 그리고 2016년 이후 연구비 신청 시에서도 암수 포함 필수 또는 과학적 근거를 제시를 하고 있고요. 성별 고려는 무작위 배정, 맹검처럼 필수적인 요소로 간주를 하고 있습니다. 그래서 기초 연구라든지 암컷을 배제한다든지 또는 데이터 분석 시에 반드시 성별별 비교라든지 결과 보고가 반드시 있어야 된다는 얘기들을 명시하고 있습니다. 자, 마지막 결론입니다. 따라서 우리 오늘 논의를 간단하게 요약해 보자면 AI와 관련된 저자 및 지침이 강화가 되었다라는 거, AI는 도구이지 저자가 될 수는 없다라는 거. 두 번째, 성별과 젠더는 연구 설계의 핵심 변수입니다. 따라서 이를 무시한 결과는 연구의 신뢰성을 떨어뜨리고 공중 보건을 위험을 초래할 수 있다라고 하고 있습니다. 따라서 AI 명시라든지 젠더 혁신과 관련되어 있는 내용들은 저희 대한통합의학회 2020년 11월 22일 개정 이후에 추후 보강해서 우리 학회지에 공표를 하고 또 따를 예정입니다. 지금까지 2025 대한통합의학회 국제학술대회 연구윤리 경쟁주제에서 감사합니다.
The next oral presentation is Neuromechanical Coordination Strategies in Anticipatory and Reactive Step-Aside Movements, a Secondary Analysis by Ling Chao Chi.
Hello everyone, my name is Ling Chao Xie, and I'd like to share our recent study entitled Neuromechanical Coordination Strategies in Anticipatory and Reactive Step-Aside Movements, a Secondary Analysis. Let me start with a bit of background. Step-aside movements are essential for maintaining dynamic balance and preventing falls in daily life. However, these movements place substantial demands on the ankle muscles, particularly the tibialis anterior, peroneus longus, and soleus, as well as on ground reaction force and central pressure modulation. Previous studies have compared self-initiated and stimulus-driven movements, but mainly in simple and single-joint tasks. So far, biomechanical differences in complex obstacle avoidance step-aside movements have not been systematically examined. This gap motivated our study. Therefore, we aimed to compare neuromechanical coordination strategies between anticipatory and reactive step-aside movements, both during standing and walking condition. To address this, we conducted a secondary analysis based on our previous experiments. 45 healthy young male participants' data were recruited for this study, and there are 4 groups: planned step-aside movements during standing, which is SASP, versus unpredictable step-aside movements during standing, which is SASU, and planned step-aside movements during walking, which is SAWP, versus unpredictable step-aside movements during walking, which is SAWU. In this analysis, we examined the time series data of electromyography, ground reaction force, and central pressure displacement. We focused on both pushing and loading legs, and we applied the one-dimensional statistical parametric mapping as known as SPM1D to identify temporal and biomechanical differences that distinguish anticipatory from reactive control. Next, let's move on to the results. During quiet standing, the SASU produced an earlier and sharper increase in the pushing leg GRF, you can see here, and following by a faster decline, indicating a more abrupt and forceful push-off compared with planned condition. And the COP shifted forward earlier and more rapidly, you can see here, which suggesting a toe dominant propulsion strategy under reactive conditions. Moreover, EMG signals, especially from the peroneus longus, you can see here, show the earlier and stronger activation even before measurable force changes occurred. During walking, the reactive condition showed a delayed peak in EMG and GRF and a prolonged stance phase compared with the anticipatory condition. This delay in both pushing and loading legs indicates slower transition timing and reduced temporal efficiency, creating a potential high-risk interval for balance loss during reactive movements. In other words, when a person must respond suddenly to an unpredictable obstacle while walking, there is a short but important moment where balance control becomes less effective. In summary, first of all, we found a delay in reactive walking conditions, which created a critical high fall risk interval. Secondly, our findings highlight distinct neuromechanical strategies between anticipatory and reactive step-aside movements. Finally, we emphasized the need for comprehensive training approaches. For example, using immersive virtual reality environments that combine agility drills and trail and aero practice. Such training could help shorten or better utilize this high-risk window, reducing fall incidents in older adults or other at-risk populations. Thanks for your attention. Bye.
The next oral presentation is the effects of modified constraint-induced movement therapy with trunk restraint on upper extremity function and activities of daily living in stroke patients by So-Young Park.
Hello, I am happy and honored to give a presentation today. I am So-Young Park. Background and purpose. The purpose of this study was to apply modified constraint-induced movement therapy with trunk restraints to stroke patients' hospitalization in a rehabilitation hospital to analyze changes in effort extremity function, and activities of daily living before and after the intervention in order to verify its effectiveness. Subjects. The subjects of this study were June to August 2025. 8 stroke patients hospitalized and K rehabilitation hospital in Busan. Selection criteria. Individuals diagnosed with dysplasia due to stroke by a physician. Individuals without cognitive impairment scoring 24 or higher on the mini mental state examination Korean. Individuals with a disease duration of at least 3 months. Individuals at stage 4 or higher in the full stroke recovery stage for the arm and hand, who are able to pronate the forearm and perform finger and thumb extension, allowing voluntary grabs and release, as suggested by Ted et al. Individuals without visual or auditory impairments capable of communication, who understood the purpose of the study and voluntarily agreed to participate. Exclusion criteria. Individuals with a history of other disease following a diagnosis of stroke. Individuals with severe cognitive impairment defined as a score of 23 or lower on the mini mental state examination. Individuals with upper extremity musculoskeletal disorders that limit additional movement or exercise. Individuals of advanced age who are considered to have a low potential for recovery or difficulty adapting to therapeutic interventions. Methods. The assessment tools included the modified Barrel Index to evaluate activities of daily living, the box envelope test to assess upper extremity function, and the motor activity log to measure motor activity performance. First, participant selection, review of medical records, MMSAK, and MBI. Random allocation. Experimental group is wearing a glove on the non-affected hand. 5 hours per day, 5 times per week. Trunk-resistant and effective upper extremity exercise program. 4 hours per day, 5 times per week. Control group is conventional therapy, 5 times per week. Final assessment, BBT, and NAN. Data processing and result analysis. Data analysis. The data were analyzed using SPSS version 22.0. Descriptive activities, including frequency analysis and chi-square tests, were used to examine the general characteristics of the participants. A Shapiro work test was conducted to verify the normality of the data distribution. Repeated measures ANOVA was performed to compare changes in WMFT and MAF, including total and subscale scores between the two groups over the intervention period. Pearson's correlations coefficients were used to analyze correlation among the total scores of the assessments. The level of statistical significance was set at alpha equal 0.05. Result. In the comparison of changes in the growth motor function test, according to biofeedback training intervention, there are statistically significant difference over the intervention period and between groups over time. Table 3.1 Comparison of WMFT changes for each group by intervention period. The WMFT scores improved significantly in the experimental group compared to the control group. Multivariate tests showed significant effects of both period and group on the stress score. Tests of within subject contrast on each group. Free process post 1166.400. Significant improvements were found within each group over time, especially between free and forced tests. However, there was no significant difference between two groups overall. Similarly, in the comparison of changes in the motor activity log for both the amount of use and the quality of movement, statistically significant differences were observed over the intervention period and between groups. There was a significant difference in effect size between free intervention and 8 weeks after intervention, but no difference between 4 weeks and 8 weeks. However, significant differences were found in all thoroughly detailed sub-items. between the groups, and a significant correlation was observed between WMFT scores and both the amount of use and quality of movement scores of the MAL used in this study. Thank you.
The next oral presentation is Relationship of Extracorporeal Shockwave Therapy on Knee Alignment in Adults with Genuvarum by Dong-Yoon Kim.
The title of this study, Effect of Extracorporeal Shockwave Therapy on Knee Alignment and Flexibility in Individuals with Genuvarum, and presenter is Dong-Yoon Kim. Genuvarum or bone redness causes outward knee alignment and is linked to musculoskeletal problems. Pathophysiology of Genuvarum: uneven loading and force imbalance in the knee joint, lateral deviation and tibia torsion, abnormal tension and compression, joint damage, inflammation, deformity of tibia and femur, muscular imbalance. Purpose: this study investigated how ESWT and stretching affect Q angle and intercondylar distance in adults with Genuvarum, and compared the results between the two groups after intervention. This study aimed to verify how ESWT improved Genuvarum compared to stretching and to provide therapeutic evidence for clinical use. This is hypothesis. Participants. This study were conducted with individuals diagnosed with Genuvarum. All participants received a detailed explanation of the study's purpose and procedure before participation and voluntarily agreed to take part in experiment. A total of 16 participants were divided into two groups, 30 in the ESWT group and 30 in the stretching group. All participants were informed of the procedure and changes were measured across the intervention period. This is measurement tools, X-ray radiographic equipment, and digital calipers. Here is the experimental procedure. Experimental group, control group, measurement variables. The data were analyzed as follows. 60 participants were divided into ESWT and stretching groups. Both groups showed similar baseline characteristics as shown in the table below. Descriptive statistics showed a gradual increase in Q angle over time in the both groups after 2 and 4 weeks of intervention. Q angle increased significantly at 2 and 4 weeks, with overall significant changes during the intervention period. Intercondylar distance gradually decreased over time in the both groups. Since sphericity was violated, the greenhouse gauge correction was applied, showing significant difference before and after intervention, and throughout the intervention period. Significant reduction in intercondylar distance were found between pre and week 2, and between week 2 and week 4, with overall significant across the intervention period. This study compared the effects of ESWT and stretching on knee alignment and adults with Genuvarum. Both groups showed improvement in knee alignment after 4 weeks, with the ESWT group showing a significantly greater increase in Q angle than the stretching group. Both groups showed significant improvement in knee alignment, with the ESWT group showing greater Q angle changes. This supports previous finding that radial ESWT enhance alignment by relaxing deep muscles and soft tissues. Reference. Thank you for your attention.
The next oral presentation is immediate effects of different stretching postures on muscle viscoelastic properties, pressure pain threshold, and cervical range of motion of the upper trapezius by Singwen Baek.
Hello, I'm Sungwon Baek, a student from the Department of Physical Therapy, Busan Health University. I'm here today to present our study title, Immediate Effect of Different Stretching Posture on Muscle Viscoelastic Properties, Pressure pain threshold, and cervical range of motion of the upper trapezius. My talk is structured as follows. First, the background and purpose, then the method, key research, and finally the discussion and conclusion of our findings. Let's begin with the background. The upper trapezius muscle is a common site for myofascial pain syndrome, and various interventions are applied in the clinic for tension relief and pain reduction. Stretching is often the first line intervention among non-pharmacological treatments. The effectiveness of UT stretching is known to vary depending on the posture and method applied. However, there is a lack of direct comparative studies on the effects of different stretching postures. Therefore, this study aimed to compare the immediate effects of posture dependent stretching method on upper trapezius muscle elasticity, pressure pain threshold, and cervical range of motion in healthy adults. Moving on the method. 34 healthy adults were randomly assigned to an experimental group or a control group. The experimental group performed a front ipsilateral cervical rotation stretch with a 1.5 cm support under the zygomatic region to maximize rotation, holding for 30 seconds. The control group performed a seated upper trapezius stretch involving deep cervical flexion and ipsilateral rotation, assisted by the opposite hand with the torso slightly tighter for 30 seconds. Both groups repeated the stretch 4 times and lasted 3 minutes after the final stretch before immediate post-intervention measurements. Outcomes were measured pre and post-stretching upper trapezius muscle mechanical properties. By myoton flow device, pressure pain threshold by a digital ergometer, and cervical spine range of motion using a CRM inclinometer. Next, we will discuss the results of our study. In the experimental group, muscle tone of the upper trapezius significantly decreased and cervical tension and ipsilateral rotation RM significantly increased. In the control group, both muscle tone and stiffness significantly decreased and relaxation time significantly increased. The pressure pain threshold significantly increased in the control group. Cervical range of motion also significantly improved in the control group. However, despite these within group improvements, no significant between group differences were observed in any measured parameter. Moving on the discussion. Our results show that both methods produce immediate relief and improved cervical function, but there was no significant difference in the magnitude of effect between the two stretching postures. The simple prone stretch emphasizing maximum rotation, achievement equivalence improvement compared to the complex seated stretch. This suggests that the choice of posture might be flexible in the clinical setting based on patient comfort. Improvement in muscle elasticity and RM can be impressive as the result of the creep effect, where short static stretching induces viscoelastic elemental relaxation and length increase in the muscle tendon unit. However, our study has limitations. The subjects were healthy adults and the sample size was small, limiting generalization to clinical population like MPS patients. Future research should diversify, increase the sample size, and evaluate long-term effects by adjusting application parameters. Conclusion. In summary, but upper trapezius stretching posture produce immediate improvement in UT muscle tone, decreased tenderness, and enhanced neck length of motion. There was no significant difference in effectiveness between the two methods. Thank you for your attention.
The next oral presentation is analysis of changes in social discourse related to dental hygienists using AI-based text mining by Eugene Cho.
Hello, my name is Eugene Zhou. Today, I'm happy to share my historical analysis of change in social discourse related to dental hygiene using AI-based text mining. In this talk, I will explain how public views about dental hygiene have changed over the last 35 years. Objectives. The role of dental hygiene has significantly expanded. We now work in clinical care, prevention, education, infection control, and community care health. Given this broader scope, it is important to understand how society perceives our profession. Therefore, the goal of this study was to examine long-term trend in public discourse using AI text meaning. We aim to analyze these changes and reflection on their implication for our future, contributing to the development of our societal and educational directions. Subjects and methods. To study this, we corrected U article that includes the word dental hygienist. The data came from the Behinds Use database. We looked at articles from 1990 to 2025. After removing duplications, we used 5,170 articles for analysis. This large amount of data helped us. We cleared the change over time. First, we cleaned the text using Python. Then we used three main methods. 1. TF. This shows which words were used most often. 2. TF-IDF. This helps us find special or meaningful words for each decade. 3. ADA topping modeling. This technique shows the main themes in the article and how those themes change over the 35 years period. This result. We identified some clear patterns. In the 1990s, article primarily focused on public health and the clinical care. In the 2000s, there was an increased emphasis on health management programs centered around the public health service. In the 2010s, key topics include education, examination, and professional identities. By the 2020s, new concepts emerged, such as prevention, aging population, infection control, and healthcare service. These trends indicate that public expectations for dental hygiene have become broader and more specialized. Topping modeling confirms this shift. Early articles focused on base dental service and public health activities, but later, new topics appeared: education and licensing, community oral health programs, prevention care, and technology in the dental field. This means people now see dental hygiene as a professional who connect public health, education, and dental technology. This slide visualizes the result of the topic modeling. In conclusion, dental hygienists are evolving into preventive care managers and integrated leaders connecting public health, education, and the dental industry. Initial focus on public oral health infrastructure, the role of the dental hygienist has expanded to encompass specialization and professional training. Today, they are not only preventive science managers but also integrated leaders in community health. In the future, they will play key roles in reducing oral health disparities, promoting community-based prevention, and leading innovation across the dental healthcare system. That's all. Thank you for listening to my presentation.
Of Timed Up and Go test for assessing motor skills in children with cerebral palsy by Yuna Bay. The next oral presentation is analysis of temporal trends in media discourse on oral health management for the elderly by Min-jong Kim.
Good afternoon, everyone. It's a pleasure to be here today. My name is Min-jong Kim, and I'm very pleased to present our study titled Analysis of Temporal Trends in Media Discourse on Oral Health Management for the Elderly. The objective of this study was as follows. As the population is oral health, in other others in increasing importance of overall health and well-being. With the expansion of community-based oral health service, such as home visit care, understanding how media and public perceptions have changed in expansion. This study analyzed the temporal change in Korean media discourse on elderly oral health management from 2010 to 2025 using testing mining and LDA topping modeling. The findings aim to provide social and public implications for developing communication-based and preventive oral health systems. We collected 2,553 Korean news articles from the Beekind database. Comparing the varied from 2010 to 2025. The main keywords were elderly dental visit, elderly oral health management, and elderly visiting dental hygienist. After removing duplication and advertisement, we analyzed the dataset using workflow physical analysis, term frequency, word cloud, and LDA topping modeling. We classified the data into 3 time periods: this 2010, 15th, and 20th. Here you can see the word clouds representing the dominant keywords for each period. In the 20th, frequency terms include implants, treatments, and health centers, showing a treatment center's perspective. In the 2050s, words like welfare, volunteer, and service appeared more often, reflecting the rise of community-based oral health programs. In 22s, keywords such as oral health, health promotion, and community became dominating, highlighting a prevent and public health focus. This slide shows the LDA topping modeling result for each period. In the 2010s, topic focused on dental treatment and implants. In the 2050s, themes expanded to public health, welfare, and community programs. In the 2012s, the main topic centers on preventive management and integrative communication, oral health. From 2010 to 2025, Korean media discourse on elderly oral health evolved from a treatment-oriented approach to communicate-based and preventive management. This shift highlights the importance of building sustained communication integrated oral health systems that support healthy aging. Thank you very much for your attention. I appreciate the opportunity to present our research today.
The next oral presentation is neuromuscular responses to eccentric wrist contractions on a novel exercise apparatus, an ultrasound EMG study by Yoonjung Cho.
Hello, I'm really excited to have the chance to present today. Let me start by briefly introducing myself. I am Hyunjung Jo, a sophomore at Jeju Halla University. The presentation will focus on our novel wrist eccentric contraction device. This presentation is structured as follows. Lateral epicondylitis is primarily caused by eccentric overload of the least extensor tendons, most commonly the extensor carpi brevis. Recent studies suggest that eccentric strengthening is the most effective intervention in this condition. Eccentric exercise is effective, however research on muscle thickness and muscle activation remain insufficient. The aim of this study was to measure muscle thickness and muscle activation during least eccentric contraction and to compare two grips, the straight type and the board type. We conducted an experiment involving 30 healthy adults, excluding participants who had a history of upper limb surgery or any other orthopedic surgical history. This device was conceived and designed by our team, and its structure is as presented here. We divide the study participants into two distinct groups to conduct the experiment. During the exercise, we measure three key variables: ultrasound, electromyography, and range of motion. We used ultrasound and EMG to measure the thickness and muscle activity on the ACLB, and at the same time, we recorded the range of motion of the least flexion angle. The statistical analysis as follows this slide. Subject characteristics are summarized as follows. Ultrasonography data show that during eccentric contraction, the straight grip decreased from 28.30 to 22.35, and the board grip decreased from 27.70 to 21.48. Within each group, reductions were statistically significant across all intervals, whereas no significant between-group difference were observed. EMG data show that for the straight grip, activation decreased from 35.07 to 13.48% in VIC, and for the board grip from 31.49 to 13.41% in VIC. Within group reduction were significant across all intervals, while no significant between group difference were observed. Maximal least flexion range of motion showed only minimal between group difference. We developed a novel eccentric least exercise device and measured ECLB muscle thickness and activation. Both grips showed the same pattern. Although different between grips were not statistically significant, the straight grip tended to remain slightly thicker during the eccentric phase. This study has several limitations. First, we assessed only a single muscle. Second, control of loading and movement
Cerebral
velocity
palsy
was
by
not
Una Bay.
well
The
controlled.
next oral presentation
So
is
future
analysis of
studies
temporal
should address
trends in
these
media
issues
discourse
and
on
also
oral health management for the
evaluate
elderly by Min
the
Jong Kim.
long-term effects of the intervention.
Good afternoon.
Only a single muscle. Second,
In
control
conclusion,
of
this
loading
device can be
and
used to
movement
apply
Cerebral
velocity
eccentric
palsy
contraction
by
not
Una
and the
Bay.
minor
The
difference
next oral
between groups.
presentation
So
is
future
analysis of
studies
temporal
should address
trends in
these
media
issues
discourse
and
on
also
oral health management for the
evaluate
elderly
we
by Min
prepare the
Jong
study
Kim.
by referring to the literature presented here
Good
on the
afternoon.
screen. Only a single muscle. Second,
Thank you for
control
listening to
of
this
loading
device
The
can be
next
used
oral
to
presentation
apply
is the
eccentric
influence of
contraction and the
predictive
minor
and
difference
actual performance
between
on
groups.
temp
So
decisions
future
by
studies
Kwang
should
temporal
address
trends in
these
media
issues and
discourse on
also
oral health management for the
evaluate
elderly
we
by Min
prepare the
Jong
study
Kim.
by referring
Hello,
to the
I'm
literature
Kwang,
presented
who
here
is
on the
in
screen.
charge
Only a
of
single
oral
muscle.
presentation
Second,
and
control of
definition
loading
of
The next oral presentation is the influence of predictive and actual performance on attempt decisions, advices of young people, trends, and media discourse on oral health management for the elderly by Min Jong Kim.
Hello, I'm Kwang. The table of contents in oral presentation we will proceed information
The next
presentation.
oral presentation is the influence of predictive and actual performance on attempt decisions, advices of young people, trends, and media discourse on oral health management for the elderly by Min Jong Kim.
Hello, I'm Kwang. In daily life, the table of contents in oral presentation we will study information
The next
presentation.
oral presentation is the influence of predictive and actual
Statements of
performance on
essence
attempt decisions, advices of young people, trends, and media discourse on oral health management for the elderly
because
by
they
Min
have
Jong Kim.
Hello, I'm to act in daily life. The table of contents in oral presentation we will study their actual information
The next
presentation. In
oral
other words,
presentation
or
is
attempt
the influence of
behavior
predictive and actual
statements of
performance on attempt
essence
decisions, advices of young people, trends, and media
behavior
discourse on
is
oral health
by
management for the elderly
because
by
they
Min
have
Jong Kim.
Hello, I'm to act in daily life. However, most of the reviews their actual
The next
presentation. In
oral
other words,
presentation
or
is
attempt
the influence of
behavior
predictive and
based on
actual
statements of
performance on attempt decisions,
in
advices of
other
young
words,
people, trends,
we
and
have
media
behavior
discourse on oral
described
health
by
management for the elderly
because
by
they
Min
have
Jong Kim.
this approach is to act in daily life. However, most of the reviews their actual
The next
in
oral
other words,
presentation
in the
is
end,
the influence of
based
predictive and actual
on
performance on attempt decisions,
in
advices of
other
young people,
words,
trends,
we
and
have
media discourse on oral health
this
management for the
study
elderly
and
by
they
Min
have
Jong Kim.
this approach is to action in daily life. However, most of the reviews is their actual
The
in other words,
presentation
in the
is
end,
the influence of
based
predictive and actual
in
performance
this
on attempt
study
decisions, advices of young people, trends,
we
and
have
media discourse on
with
oral health
this
management for the
study.
elderly.
I would appreciate it if you could record it. However, most of the reviews is that in other words, on the achievement with the based on in this major purpose. In other words, we have behavior with this I would appreciate it. There are two hypotheses. First, the larger purpose of this prediction on the more dangerous attempt decisions will be made. Second, the more physical activity you have, the more experimental procedure was measured and evaluated in the order of the predictive performance ability, actual performance ability, attempt decision, and physical activity. However, the specific purpose of the study was not notified in experimental procedure was prevent cognitive evaluated bias in the other of the predictive performance ability. In this study, the actual performance ability was attempt to measure prediction and actual performance. In particular, the predicted distance was measured in three directions: front, rear inner, and rear outer by using the laser pointer to shoot the laser point where the subject predicted that it could be stretched to the maximum. The actual performance was measured for distance after the actual performance was performed in the same way. Measurements were normalized to lower extremity lengths. The crossing attempt time was measured by showing the same video to the subject and recording the individual prediction attempt limit in seconds by asking questions such as, do you want to start crossing when there are seconds left? The physical activity evaluation measured the total working amount and total working time during the week through the information recording on the smartphone. It was analyzed using SPSS statistical program. The general characters of the subject were as follows. As a result of the normality test, most of the variables satisfied the more normal distribution, but did not satisfy the normality in the crossing attempt time and total working time variables. So Pearson and Spearman correlation analyses were performed in parallel. Both analyses results showed the same correlation in the same direction, so the Pearson analysis results were present as representative values. This is the main result. There was a very high correlation between left and right predictive performance. In other words, the predictive trend on one lower extremity was almost the same on the other. There was a moderate correlation between left and right actual performance. As a result of analyzing the correlation between the prediction of the left and right and the actual performance ability in terms of consistency between the left and right performance ability, the predictive performance ability showed very high consistency, while the actual performance ability showed moderate consistency. The difference between left and right prediction actual performance showed a strong positive correlation with each other, confirming that the pattern of cognitive error is consistent left and right. There was a negative correlation between the prediction actual performance difference and the time of attempt crosswalk. The larger the prediction actual performance difference, that is, the more they overestimate their ability, the more dangerous they made when they attempt to cross when they were fear crosswalk signal. In other words, the difference between prediction and actual performance show a significant negative correlation with the time of crossing attempt, which is attempt decision variable. This means that the more accurately one perceives one's ability, the safer one makes a judgment. This is the last one. It shows the correlation between the amount of physical activity and the predicted actual performance difference. This is left. It's on the right. As you can see, both left and right showed a negative correlation in the correlation between the prediction actual performance difference value. And the higher the amount of physical activity, the better the self-objectification tends to be. This study provides evidence that attempt decisions depend more sensitively on the consistency of predictive real performance than on actual performance. In other words, how exactly do you know is the basis for making the attempt decision, not how strong. In addition, the amount of physical activity was found to be a key factor in improving this consistency. This showed that the experience of repeated feedback, not just exercise, improves self-awareness. Therefore, clinically, a system is needed to move beyond traditional outcome-driven drive assessment to visual and education, the challenge, and predictive actual performance difference. This will allow us to present a new paradigm of evaluation. With this, I will end my presentation. Thank you for your attention.
The next oral presentation is current intervention trends and efficacy tendencies of rotator cuff strengthening and scapular stabilization exercises in patients with chronic subacromial pain syndrome, a narrative review for program configuration analysis and clinical recommendations based on the Pedro scale by Juk-young Kim.
Hello, my name is Juk-young Kim, and on behalf of my team, I'm truly honored to present our study today. Current intervention trends and efficacy tendencies of rotator cuff strengthening and scapular stabilization exercises in patients with chronic subacromial pain syndrome. I will begin with the background and purpose. Subacromial pain syndrome, or SPS, is one of the most common musculoskeletal disorders causing shoulder pain. In clinical practice, both rotator cuff strengthening and scapular stabilization exercises are widely recommended. However, there is a significant lack of clear clinical consensus on which intervention is truly superior or what constitutes the most optimal program design. This makes it difficult for therapists to make evidence-based decisions. Therefore, the purpose of this narrative review was to analyze recent randomized control trials. We especially aim to provide clinical evidence for optimal physical therapy program configuration by systematically analyzing two key factors. First, the methodological quality of the studies using the Pedro scale, and second, the tendency of effects according to the intervention duration. Next, I will explain our subjects and methods. For our subjects, a total of 12 randomized controlled trials published between 2015 to 2025 were included in our final analysis. These studies were selected based on our established criteria and focused on applying RC or SS exercise interventions to patients diagnosed with SPS. For our methods, we searched major databases like PubMed, ScienceZone, and Google Scholar, and two independent assessors evaluated the methodological quality of each study using the Pedro scale. We then analyzed the components of the programs and the tendency of effects on pain and function, categorizing the findings by intervention, duration, and by the Pedro score. This is a figure of our research finding process. Now I will present the results. Our analysis yielded three key findings. First, regarding duration, the midterm intervention groups lasting 6 to 8 weeks showed the most consistent and distinct positive effects on both pain reduction and functional improvement. In contrast, long-term intervention like 12 weeks showed a tendency for the difference in effects to decrease. This is a table of these results. Second, regarding quality, this is our most significant findings. In the excellent quality group like Pedro 9, The results were split evenly 50-50 between superiority and no difference in the good quality group, like scores 6 to 8, the highest proportion, 44%. Also reported no difference. This critically shows that as study quality increases, the evidence for one exercise type being superior decreases. This is also a table of these results. Third, regarding current practice, we found the 83.3% of the included studies already use a combined intervention approach rather than choosing one over the other. Finally, our conclusion. Our review confirms that both rotator cuff strengthening and scapular stabilization exercises are effective treatments for patients with chronic SPS. However, the data provides two critical clinical implications. An intervention duration of 6 to 8 weeks appears to be the most critically efficient timeframe. Second, and more importantly, the lack of a clear winner in high-quality studies suggests that the debate over which exercise type is better may be misplaced or irrelevant. The evidence strongly indicates that an individualized, integrated approach, one that focuses on the patient's specific functional deficits and neuromuscular control, is far more important than the exercise type itself. That concludes my presentation. Thank you for your attention.
The next oral presentation is the effects of lumbar stabilization exercises on gait in university students with low back pain by Lin Lee.
Hello everyone, I'm Lin from Busan Health University. Today, I will present our study on the effect of lumbar stabilization exercise program gait patterns in university students with low back pain. Background and purpose. In modern societies, scientific advancement had led to change in lifestyle, which have resulted in decreased physical activity and poor posture. This change has weakened the muscles surrounding the lumbar region, ultimately causing lumbar dysfunction and pain. Low back pain greatly affects functional movement, especially showing a tendency toward reduced stride length and an increased base of gait. Although many previous studies have analyzed the activation of deep stabilizing muscles through trunk stabilization exercise, there has been limited research on how this exercise influences gait. Thus, this study aimed to examine the effect of lumbar stabilization exercise on the gait patterns. Subject. This study involved 15 university students in their 20s from a university in Busan, and participants report chronic low back pain with a visual analog score of 5 or higher, and voluntarily agreed to participate and complete the 2 weeks intervention program. Those who had a history of surgery of disc-related symptoms without low back pain were excluded. The participants consist to 10 males and 5 females with a mean age of 23 years and an average BAS score of 6.87. Method. In this study, pain scores were measured using the BAS, and disability was assessed using the Oswestry Disability Index. To measure stride length and base of gait, we used gait checker. and we filmed the participant in the sagittal plane after attaching stickers to the joint landmark of their hips, knees, and ankles to confirm the pre- and post-intervention range of motion change. The intervention program included pelvic and lower extremity relaxation, deep core contraction, and strengthening exercise. We distribute a guided video showing all movements and encourage the participants to perform them once daily for 2 weeks. And all data were measured before and after the intervention and analyzed using pyridate test result. Next, I would like to present the findings of this study. The pain score significantly decreased from 6.87 before the intervention to 4.93 after the intervention. The intervention led to the substantial increase in gait stride length from 78.94 cm to 96.6 cm, and the base of gait significantly narrowed, decreasing from 28.82 cm to 22.27 cm. The RM also showed a significant increase in the hip joint angle from 23.4 degrees pre-intervention to 26.2 degrees post-intervention. This indicates that hip joint uses during walking increased. We did not, however, observe any significant changes in the knee and ankle joint angles. This suggests that the compensation effect is not always consistent and highlights the complexity of joint interaction. For the reason, more specific studies will be necessary. Conclusion. Our findings suggest that lumbar stabilization exercises can effectively reduce minor and unnecessary movements of the spine in chronic low back pain patients. This is achieved by relieving muscular imbalances and overload around the pelvis. As a result, patients experience a reduction in pain and their muscle function is restored. This leads to improved pelvic movement control, is increased stability in the lower extremities. Consequently, the observed increases in hip joint RM and stride length, along with a decrease in a base of support, contribute to increased gait efficiency. These findings support lumbar stabilization exercise as an important rehabilitation strategy for improving functional walking in individuals with chronic low back pain. Limitation. However, this study has several limitations. First, the number of participants was limited. Second, this study observed only the short-term effect of the intervention, making it difficult to verify its long-term effect. Third, the gait analysis did not include various parameters such as walking speed and ground reaction force. Therefore, future research should include a larger sample size, a longer intervention period, and a verified of gait analysis to more deeply investigate the effect of lumbar stabilization exercise. That brings me to end of my presentation. Thank you for your attention.
The next oral presentation is the effects of various core stabilization exercises applying abdominal hollowing on pulmonary function and respiratory muscle thickness by Sua Kim.
Hello, I am Sua Kim from the Department of Physical Therapy at Gyeongnam College of Information and Technology. Now I will present our study on the effects of dead-burger exercise combined with breathing techniques on pulmonary function and respiratory muscle thickness. Here is the table of contents. Robbins and Dworkin reported that the diaphragm works during inspiration and abdominal muscles during expiration. McGill highlighted the close link between respiratory muscles and trunk stability. And Montes et al. Emphasized that TRA and IO regulate intra-abdominal pressure, essential for posture and movement. McGill also introduced the hollowing and bracing for abdominal stabilization. Cavagioni reported that abdominal bracing training benefits muscle strength and pulmonary function, while Yoon et al. Found that dead-burger exercise effectively activates abdominal muscles. Previous studies examined dead-burger exercise or abdominal bracing separately. This study aimed to investigate their combined effects of abdominal respiratory muscle thickness and pulmonary function. We hypothesized that bracing would increase muscle thickness, hollowing would improve pulmonary function, and both would be positively related. Methods. 30 participants were randomly assigned to 3 groups and exercised 3 times per week for 4 weeks. Pulmonary function and muscle thickness was measured before and after the intervention. Data were analyzed using SPSS 26 with one-way ANOVA and paired t-test, alpha equals 0.05. Participants were assigned to hollowing, bracing, or control groups. Hollowing activated the TRA, bracing co-contracted or abdominal muscles, and the control group had no specific bracing instructions. This study included only healthy adults without abdominal, musculoskeletal, or respiratory disorders, and no prior training experience. Pulmonary function and muscle thickness were measured using a spirometer and ultrasound, with biofeedback used in the following group. Result. Before the intervention, there were no significant differences between the groups. After 4 weeks, the bracing group showed significant increase in TRA, IO, EO thickness, and PF, and the hollowing group's result improved. Also, the control groups improved but less markedly. The FEV1/FEV3 ratio differed significantly among groups, with the control groups showing the greatest improvement. Overall, TRA and IO thickness increases mostly in the bracing group. Here is the discussion. McGill described bracing as a contraction of our abdominal muscles, whereas Richards defined hollowing as selective activation of TRA. Accordingly, our results suggest that co-contraction in the bracing group produced greater TRA and IO activation. Previous studies reported that abdominal contraction reduced airway resistance and improves PF, but Sambara et al. Noted that bracing may restrict breathing by reducing lung volume. Consistent with this, the FEV1/FEV3 ratio decreased only in the bracing group, suggesting that clinical use of bracing should be approached with caution. Limitations include a short or weak intervention, healthy young adult participants limiting generalizability, and no EMG analysis to directly measure muscle activity. In conclusion, the above exercise improved abdominal respiratory muscle thickness and pulmonary function, especially when combined with breathing techniques. This suggests that core stabilization with breathing control may be an effective strategy to enhance both respiratory muscle function and trunk stability. This is an abdominal ultrasound. Thank you for listening my presentation.
Finally, the last oral presentation is effects of neck McKenzie exercise and self-fascial muscle relaxation exercise using foam rollers on neck extension and forward head posture by Purim O. Rollers on neck extension and forward head posture by Purim O.
Good morning, my name is Purim Oh from the Department of Physical Therapy at Gyeongnam College of Information and Technology. Today, I will present our study on the effect of McKenzie exercise and thoracic self-myofascial release using a foam roller on cervical extension and forward head posture. This study was conducted together with focal researchers under the supervision of Professor Gonchal Lee. The presentation will follow 5 sections. Introduction. Forward head posture is a common posture problem. It causes excessive extension of the upper cervical spine and flexion of the lower cervical spine, leading to abnormal loading and musculoskeletal disorders. It also influences the thoracic spine, shoulders, and rib cage, reducing mobility and impairing respiratory function. Previous study reported that McKenzie exercise, which use repeat directional movements, are effective in correcting posture and restoring function. Meanwhile, foam roller self-myofascial release reduce fascial adhesions, promote muscle relaxation, and increases joint range of motion. Based on this background, our study aimed to investigate how McKenzie exercise and thoracic foam roller release affect CRM, CVA, and SCM motion in young adults with posture dysfunction. Our hypotheses were 1. Both interventions would improve CRM. 2. Both would produce change in CRM, CVA, and SCM myoton. 3. The McKenzie exercise would be more effective than the foam roller and control conditions. 4. Foam roller exercise would be more effective than control condition. Method. This was a randomized controlled trial with 42 participants in their 20s and 30s who had forward head posture and limited cervical extension. They were randomized divided into 3 groups. Group A, McKenzie exercise. Group B, foam roller self-myofascial release. Group C, control. The intervention was conducted 3 times per week for 4 weeks. Pre and post tests include cervical RM using a CRM instrument, CVA using Piezo-Meister app, SCM motion using Myoton Pro. After the intervention, post-tests were carried out. 4 groups, comparison one-way ANOVA and LSD post-hoc tests were used. Research. Baseline homogeneity analysis showed no significant difference among the groups in age, height, or weight. CRM. Both McKenzie and foam roller groups show significant improvements in cervical extension, while the control group showed no change. No difference was found between the 2 intervention groups. CVA. A similar pattern was found in the CVA. Both the intervention group improved significantly, but the control group showed no change. No significant difference was observed between McKenzie and foam roller groups. SCM motion showed no significant change in any group. Discussion. Our findings confirm that both McKenzie and foam roller exercise improve cervical extension and forward head posture. supporting earlier studies. However, unlike some previous research, we found no significant improvement in SCM milestone. This may be due to the individual difference in baseline tone. Limitation: short innovation duration 4 weeks, daily lifestyle factors were not controlled. Conclusion: both mechanics and foam roller exercise affected improved cervical extension and forward posture. There was no significant difference between the two methods, suggesting similar effect despite different mechanisms. Neither innovation improved SCM motion, possibly due to the short innovation period or lack of direct stimulation. These findings indicate that both exercise can be practical non-pharmacological approaches for posture correction. This concludes my presentation from the Department of Physical Therapy at Gyeongnam College of Information and Technology. Thank you very much for your attention.
Hugh Kang.
Hello everyone, my name is Jungkyu Kang from Dong University of Korea, and what I'm going to talk about today is our study titled The Effect of Half Lunge with Visual Feedback and Axial Shortening Exercises on the Thickness of the Iliopsoas Muscle. Here is an overview of our poster, and I'll walk you through from background to conclusion. And as you know, low back pain affects over 80% of people in their lifetime, and the iliopsoas helps stabilize the spine and pelvis. When it's weak or too long, it can cause hip and lumbar instability. Exercises such as axial shortening and the half lunge are used to strengthen this muscle. But there is no clear study comparing which exercise is more effective, or how results differ depending on muscle length. So we tested which one works better for each muscle type. And 20 participants joined the study, and they were divided into two groups by the modified Thomas test, an MTT positive for elongated muscle and MTT negative for normal ones. And everyone did both exercises, and we measured the psoas thickness at rest and during contraction using ultrasound. We used the pair and independent test for analysis with significance at 0.05. And this table shows our main results, and let's take a closer look. First, both exercises lead to clear increase in psoas thickness, showing effective muscle activation. When comparing the two exercises, the half lunge showed better result in the normal group, but in the elongated group, there was no significant difference. In short, both exercises are effective. For elongated muscles, start with axial shortening to restore normal length and activation, and then progress to half lunge to build strength and control. Thank you for listening. I wish this study helps people with low back pain and stability issues.
The next poster presentation is effects of ankle proprioception and strengthening exercises on ankle joint muscle activity, balance, and gait in adults by Min-jae Son.
Hello, my name is Min-jae Son, student of Dong University. Our team did a study about the effects of proprioceptive training and muscle strengthening exercise on ankle muscle activation, balance, and gait in adults with chronic ankle instability. Ankle sprain is one of the most common injuries in sports and may lead to chronic ankle instability. Proprioceptive exercise and strengthening exercise are major interventions for CAI. This study aimed to compare these exercises and provide clinical evidence for selecting appropriate exercise. 20 adults with CAI were recruited and randomly assigned 10 to proprioceptive group and 10 to strengthening group. These pictures show proprioceptive exercise and strengthening exercise. Both exercise was done 3 times a week for 3 weeks. We used EMG system to measure muscle activity, biorescue system for balance, and X-body system for gait analysis. For results, proprioceptive group showed a significant increase of medial gastrocnemius muscle activation in pre to post comparison and when compared to strengthening exercise group. Top 6 variables are for static balance and strengthening group showed significant improvements in length and average speed when eyes closed. Both groups showed improvements in dynamic balance, which is limit of stability, but no difference between groups. Both groups showed improvements in gait analysis within group, but no difference between groups. This study confirmed that proprioceptive exercise promote activation of ankle stabilizer muscles, whereas strengthening exercise enhance coordination of ankle muscles, leading to improved balance ability. Both exercise improve gait ability. Clinicians are advised to select or combine these exercises according to patient's functional status and rehabilitation goals. Thank you for listening.
The next poster presentation is usability test of an overground walking assistance robot based on Mecanum wheels by N-Pyong Choi.
Hello, my name is Choi Pyong. I will present on usability test of an overground walking assistance robot based on Mecanum wheel. Robot-assisted gait rehabilitation has gained attention with recent technological advances. In response, an overground walking assist robot using Mecanum wheels was developed. A usability test was conducted to confirm the appropriateness for users. Therefore, this study aimed to assess the satisfaction of stroke patients and physical therapists through this usability test. A total of 19 participants were included in the study, consisting of 4 stroke patients and 15 physical therapists. Participants worked using the prototype in a sufficiently large area and then completed a satisfaction questionnaire. The satisfaction questionnaire consisted of 20 items across 3 domains assessed using a 5-point Likert scale. A mean score of 4 or higher indicated stability. Satisfaction survey results showed that both groups rated convenience as stable, while the other 2 domains were rated as unstable. In conclusion, the need to improve the 2 unstable domains was identified, and ongoing development research is required for product commercialization.
Next poster presentation is correlation and path analysis of head control, visual perception, and hand function according to GMFCS levels in children with spastic cerebral palsy by Yongjin Park.
My name is Park Yong-jin, and today I will present our study, Correlation and Path Analysis of Head Control, Visual Perception, and Hand Function, according to GMFCS levels in children with spastic cerebral palsy, preliminary experimental study. The purpose of this study was to analyze the structural relationships among head control, visual perception, and hand function, and to examine how these relationships differ according to GMFCS levels. We recruit 15 children with spastic cerebral palsy, classified into GMFCS levels 1, 2, 3. Assessments include EMG for head control, the Diner-Peck test and Jackson-Taylor hand function test for hand function, and the MV54 for visual perception. Our results showed that higher GMPC levels were associated with overall decline in head control, hand function, and visual perception. Children at GMPC1 showed relatively stable performance. Children at GMPC2 exhibited greater variability across measures, and GMP3 demonstrate the longest task times, the lowest scores. And less consistent muscle activation, visual perception was relatively preserved in GMPC1, variable in GMPC2, and clearly impaired in GMPC3. In conclusion, this finding suggests that head control and hand function and visual perception are closely related, and the functional declining becomes more evident at higher GMPC levels. This result may provide clinical implications for designing effective intervention in children with cerebral palsy. Thank you for your attention.
The next poster presentation is the impact of verbal violence experienced by health science students during clinical practice on self-esteem by Sunmi Lee.
"2025 International Conference Poster Presentation: The Impact of Verbal Violence Experienced by Health Science Students During Clinical Practice on Self-Esteem." Presenter Lee Sunmi, Department of Dental Hygiene, Kyungnim College of Information and Technology, Republic of Korea. Background and purpose: dental hygienists frequently interact with patients, caregivers, and healthcare professionals, and in this process, they may encounter both physical and verbal violence. Among these, verbal violence can inflict psychological harm such as humiliation and anger. Health science students, including dental hygiene majors, are often exposed to verbal violence during clinical training, which may undermine their emotional stability and self-esteem, leading to decreased self-efficacy and professional confidence. This study aimed to examine the impact of verbal violence experienced by health science students during clinical and to provide foundational data for creating a healthier clinical training environment. Subjects and methods. From October to November 2023, a survey was conducted with 250 health science students at K University, and 238 valid responses were analyzed. The survey instrument included 5 items on general characteristics, 26 items on verbal violence, and 25 items on self-esteem, all measured on a 5-point Likert scale. Data were analyzed using SPSS version 26.0, employing frequency analysis, t-tests, one-way ANOVA, correlation analysis, and multiple regression analysis. Results. 1. Students reported higher levels of verbal violence from healthcare professionals than from patients and caregivers. 2. Fourth-year students and nursing students reported the highest levels of verbal violence, while dental hygiene students reported the highest self-esteem, with nursing and clinical pathology students showing relatively lower levels. 3. Verbal violence from healthcare professionals had a significant negative effect on self-esteem. 197, p. 05, whereas verbal violence from patients and caregivers showed no significant relationship. Conclusion. Health science students are exposed to various forms of verbal violence from both healthcare professionals and patients' caregivers during clinical practice, which negatively affects their self-esteem. Therefore, educational programs addressing the prevention and management of verbal violence should be implemented prior to clinical training. Such initiatives may help protect students' self-esteem and support their development into competent healthcare professionals.
The next poster presentation is Initial Effects of Unilateral Sling Bridging Exercise on Plantar Pressure and Stance Phase Symmetry by Sung-Hyuk Lee.
Hello, my name is Sung-Hyuk Lee. Today, I will present my study titled Initial Effects of Unilateral Sling Bridging Exercise on Plantar Pressure and Stance Phase Symmetry. The purpose of this study was to investigate the immediate effects of unilateral sling bridging exercise on bilateral plantar pressure and stance phase symmetry in adults with asymmetric weight bearing. A total of 24 adults with a plantar pressure difference of 6% or greater between both feet participated in this study. The unilateral sling bridging exercise was performed on the rim bearing greater weight, consisting of 3 sets of 10 repetitions. The plantar pressure and stance phase symmetry indexes were measured before and after the intervention. A lower symmetry index value indicates less asymmetry between the left and right side. After the intervention, the plantar pressure symmetry index improved from approximately 18% to 14%, showing about a 21% reduction in asymmetry. In addition, the stance phase symmetry also improved by around 10%, indicating that the unilateral sling bridging exercise had a positive effect on overall weight-bearing balance. In conclusion, the unilateral sling bridging exercise immediately enhances weight-bearing symmetry. Therefore, it can be applied as a practical approach for early postural correction in clinical settings. Thank you.
The next poster presentation is the impact of verbal violence experienced by health science students during clinical practice on self-esteem by Sun-Mi Lee.
Good afternoon, everyone. I'm Min-Young Lee. Today, I will present our systematic review or notice for VMI and handwriting in children with developmental disability, co-authored by Dr. Haeon Oh and O.T. Sumin Kim. I will cover the introduction, method, result, and conclusion. Children with developmental disabilities often struggle with VMI and handwriting. This impacts their academic achievement. Occupational therapy is a key intervention for these skills. Existing research is often small scale, limiting generalizability. Our purpose was to systematically review the evidence for effective strategies. For our method, we followed Prisma guidelines. We searched database like PubMed and Scopus for studies from 2015 to 2025. We used the PICOS framework. Population was children with DD. Intervention was occupational therapy and outcomes were VMI or handwriting skills. As the Prisma diagram showed, we started with 135 articles and completed our synthesis with 9 final studies. For our results, the 9 studies included children with ASD, DCD, and ADHD, mostly ages 4 to 8. The study design was diverse, including 4 ICCs. 4 main intervention methods were identified: sensory integration, digital or motion, recognition training, task-oriented training, and play-based activities. Moving to the quality assessment for the ICTs, we used the ROB2 tool. The risk of bias ranged from some to high, mainly due to high dropout rates and a lack of access blinding. For the non-randomized studies, we used the Robbins-1 tool. These studies generally showed a moderate level of bias. This was often due to confounding variable and access blind issues. Here are the main effects. First, sensory integration improved foundational motor functions. Second, digital intervention enhanced VMI and self-efficacy. Third, task-oriented training was most effective on handwriting, legibility, and speed. In conclusion, OT interventions show positive potential, but the evidence quality varies. The most reliable evidence supports structured training by a therapist with this digital technology as an adjunctive tool. Future research urgently needs rigorous ICTs with access blinding and long-term follow-up. Thank you.
The next poster presentation is the efficacy of occupational therapy on VMI and handwriting in children with developmental disabilities. A systematic review by Min-Young Lee.
Good afternoon, everyone. I'm Min-Young Lee, presenting effects of motor motors and sensory OT on feeding development in children with dysphagia, co-authored by Dr. Heon Oh and OT Sang-Hwa Lee. Here is our agenda, background, and method, results, and conclusion. Pediatric feeding disorder is common, affecting over 80% of children with neurological disorders. This brings a serious risk of aspiration pneumonia. OT is critical using sensory and motor intervention to help. We found a research gap, no recent systematic reviews on this topic since 2021. So we analyzed the latest literature to evaluate the effects of OT interventions. Using PCOS, we included children under 18 with developmental dysphagia. The intervention was non-invasive oral or sensory OT, and we measured feeding development outcomes. We searched PubMed and CINAHL for studies since 2021 from 334 articles. We used the Pedro scale to select 11 final studies. Our results show cerebral palsy is the main population at 45.5%, but we found a notable absence of studies on autism. This suggests a paradigm shift, viewing ASD feeding issues as sensory or behavioral, not mechanical dysphagia. Oral motor therapy was the most dominant intervention at 63.6%. Importantly, all 11 studies reported positive effect on feeding development. We found a clear assessment dichotomy, CP studies used function-centered tools like VFSS. Other studies used behavior-centered scales like Bambi. This confirms a bottom-up approach for CP, but highlights a need to integrate both functional and behavioral assessment. We must be cautious. The evidence is limited by a high risk of bias. This is a structural challenge in our field due to ethical issues and the impossibility of blinding. In conclusion, OT interventions show positive effects, but the evidence has a high risk of bias. We recommend more rigorous ICTs, new research into ASD feeding issues, and integrated assessment protocols. Thank you.
The next poster presentation is thymoquinone inhibited epithelial mesenchymal transition in hepatocellular carcinoma, HUS7 cell line by Chungmu Park.
Hello, this is Chungmu Park in Dong University. Today I'm going to talk about thymoquinone inhibited epithelial mesenchymal transition in hepatocellular carcinoma, HH7 cell line. Hepatocellular carcinoma, called for HCC, shows high metastatic potential driven by epithelial mesenchymal transition, called for EMT. EMT promotes tumor invasiveness, migration, and therapeutic resistance. So many researchers try to find natural compounds capable of modulating EMT-associated progression in HCC. Thymoquinone, the main compound of Nigella sativa, exerts anti-cancer effects and regulate pathways central to EMT activation. Prior findings suggest that TQ can restore epithelial features and downregulate mesenchymal markers in HCC. However, its exact mechanism is not fully understood. So this study aims to make clear the inhibitory effect of TQ on EMT pathways in HCC. WST1, wound healing, and Western blot analysis were performed. As you see in this result, TQ inhibited the migratory effect and modulated the cadherin switch by upregulating E-cadherin and suppressing N-cadherin expression. Furthermore, key EMT-related transcription factors, including snail, beta-catenin, and NF-kappa B, were attenuated by TQ treatment. In conclusion, these findings provide mechanistic evidence that TQ is a potent natural compound capable of mitigating EMT-driven malignant phenotypes in HCC. TQ may serve as a promising therapeutic candidate for limiting invasion and metastasis in HCC. Thank you for listening.
The next poster presentation is the relationship between tongue cleaner use and the oral environment by Chungmu Park.
Hello. Today I'm going to talk about the relationship between tongue cleaner use and the oral environment. My name is Chungmu Park in Dong University on behalf of Hyun Seo-yoon. Tongue cleaners have been reported to aid in reducing halitosis. However, the usage rate remains below 30% as of 2023. This study aimed to evaluate the efficacy of tongue cleaner use by analyzing oral environmental indicators. Participants were juniors and seniors measuring dental hygiene from a selected region. Salivary component analysis was conducting used a SILHA device. 7 parameters as follows: tooth-related factors, periodontal factors, and oral cleanliness were investigated. Participants used 3 types of tongue cleaners over 3 weeks. After use, The tongue cleaners were collected and analyzed their microbial condition by culturing in BHI media. Carcinogenic bacteria was low in 57.1% of participants, indicating an overall low caries risk. Acids tend to be high. Periodontal indicators show moderate to high levels of occult blood, leukocyte, and protein. Ammonia levels were mostly low. Participants exhibited low resistance to periodontal disease, as reflected by elevated inflammatory indicators. Tongue cleaners suppress the oral microbial growth. However, effectiveness differs depending on the type of tongue cleaner. These findings underscore the need for promoting benefits of tongue cleaner use and providing education on selecting proper products for maintaining optimal oral hygiene. Thank you for listening.
The next poster presentation is the relationship between major relevance and job satisfaction among medical technologists in Korea by Chung-Moo Park.
Hello, my name is Chung-Moo Park in Dong University. Today I'm going to talk about the relationship between major relevance and job satisfaction among medical technologists in Korea. With the increasing utilization of healthcare services, the demand for medical technologies has been steadily rising. However, discrepancies often exist between academic preparation and actual job duties. This study aimed to investigate the degree to which academic majors are helpful in current workplaces and to analyze job satisfaction among 6 medical technologist occupations. This study analyzed data from the 2020 Graduate Occupational Mobility Survey in Korea. Participants were 487 graduates from 3 or 4-year programs leading to licensure in 6 medical technologies professions. The degree to which their major was helpful in their first and current workplaces, as well as job satisfaction in the current workplace, were measured using a 5-point Likert scale. In the first workplace, dental hygienists show the highest relevance, while occupational therapists show the lowest. In the current workplace, radiologic technologists showing the highest and dental technicians the lowest. In the current job satisfaction scores, radiologic technologists show the highest satisfaction and occupational therapists the lowest. While the demand for medical technologies continues to increase, the proportion of licensed professionals actively engaged in their field is declining. Enhancing the practical alignment with the university curricula and workplace demands, along with improving early career job satisfaction, may contribute to sustaining professional engagement and workforce stability among medical technologists. Thank you for listening.
Finally, the last poster presentation is Physiotherapeutic Approaches to Tension-Type Headache, Recent Trends with a Focus on Neurofeedback by Yoon-Yi Lee.
Hello, my name is Yoon-Yi. We are from Department of Physical Therapy in Gyeongnam College University of Information and Technology. Today, our topic is physiotherapeutic approaches to tension-type headache, recent trend with a focus on neurofeedback. Tension-type headache is a common primary headache linked to muscle tension and stress, causing reduced quality of life. This narrative review examines the physiological mechanism and the clinical effectiveness of manual therapy, exercise therapy, adjunctive method, multimodal programs, and neurofeedback intervention in adults with tension-type headache. Although this review does not have a specific subject group,
Relevant studies were selected to address the topic comprehensively. Literature published between January 2015 and April 2025 was systematically searched in PubMed, DBpedia, KISS, and Google Scholar. Studies were included if they involved adult TTH patient, applied physiotherapy intervention, and reported clinical outcomes such as headache intensity, frequency, or quality of life. 3 reviewers independently screened and evaluated the literature, and the 14 studies were descriptively synthesized by intervention type. Cross-randomized controlled trials and systematic reviews, manual therapy, exercise therapy, adjunctive and multimodal intervention, and the neurofeedback showed consistent reduction in headache intensity and frequency with improvement in disability and quality of life. Combined or multimodal approaches yielded superior and more sustained effects compared with single modalities. TENS was most effective when added to physiotherapy, while AVE led to beta band suppression, alpha band enhancement, and autonomic stabilization. Temporal lower frequency neurofeedback demonstrated session-wise decreases in headache probability and increased corticolimbic connectivity. Evidence quality varied due to short follow-up and heterogeneity across protocols. Physiotherapy for TTH is effective, particularly when integrated peripheral and central regulation strategies. An integrated pathway, manual, or exercise therapy combined with neurofeedback and adjunctive modalities appears clinically synergetic and conceptually justified. Future research should establish standardized neurofeedback protocols and long-term follow-up to strengthen evidence for central peripheral integration in TTH management. Thank you for listening to our presentation.
이것으로 오늘 준비된 모든 학술대회 일정을 마치겠습니다. 참여해주신 모든 분께 감사드리며 자리를 지켜주신 참석자 여러분께도 감사드립니다. 저희 대한통합의학회는 앞으로도 통합의학 발전을 위해 노력하겠습니다. 감사합니다. This concludes today's entire academic conference schedule. We thank everyone who participated, and we also extend our sincere gratitude to all attendees for staying with us. The Korean Society of Integrative Medicine will continue to strive for the advancement of integrative medicine. Thank you.